So we are just waiting on a few more council members and then we'll get started.
Yes.
Hi, Dale. Carmen.
Okay.
Okay, I see that we have at least enough present for a quorum, and so I'm going to call this Committee of the Whole Budget Update hearing for Monday, November 16th to order and ask the clerk to please call the roll.
Good afternoon. Calling the roll for Ms. Simon,
Here.
Ms. Baker, Ms. Baker, Mr. Miller,
Here.
Mr. Tuma,
Here.
Mr. Gallagher, Mr. Schron, Ms. Conwell,
Present.
Here.
Mr. Jones, Mr. Jones, Ms. Brown,
Here.
Ms. Stevens,
Present.
and Mr. Brady.
Here.
And Vice President Jones is in attendance, I know.
Thank you.
So we have a quorum present.
Yes, we do.
And thank you very much. And the next item on the agenda is public comment.
Mr. Chair, we did receive public comment from the Cleveland Clergy Alliance, and I have submitted the public comment via email to you, and you were all on the distribution list, and I have also saved it to the meeting in the file.
Great, thank you very much. And the public comment is very, very brief, so I believe I can just read it to everybody as follows. It says, "Greetings. On behalf of Lorenzo Norris, President and CEO, please see and add the public comment listed below. The Cleveland Clergy Alliance is requesting continued funding of $150,000 for 2021 to connect or help seniors and adults with disabilities that are impacted by COVID-19. Thank you in advance for your consideration in this matter. Respectfully submitted, Terry Johnson, Community Outreach Administrator, Cleveland Clergy Alliance." So that concludes the public comment. So welcome to session 2 of the budget update hearings for 2021, focused on health and human services. I have one follow-up from Monday's session, and credit is due to Councilman Tuma for vigorously following up on comments made at that session about the building retrofit projects. We know from the meeting Scott held on Friday that we will have between $10 and $15 million in CARES Act money left over from building retrofit work, and we will be rushing to spend CARES Act money before the December 31st deadline. Councilman Tuma and others raised the possibility of assisting municipalities, knowing that they would be under the same December 31st deadline, and being very clear that this is only a possibility and nothing is promised. You might consider approaching your municipalities to see if there's CARES Act eligible work for which we could assist. Of particular interest would be projects already underway and near conclusion that would be CARES Act eligible but are currently funded with local money. This could even be done on a reimbursement basis. Before we get to today's main presentation, we have two other items of business. The first is the Manatron contract, which is our property tax system until it is replaced by the Harris system, which is in the process of being installed. I have asked Council President Brady to refer this item here so that we would not have to have a separate finance and budget meeting. The second item of business is the Metro Health budget for 2021. We are required by state law to approve the Metro Health budget, although we have limited power to amend it. The actual resolution will not be introduced until the November 24th council meeting, but Metro Health CEO Akram Boutros was available to present it as part of our budget update, and we thought it made sense to do so. The 2021 budget update does not contain any change in the subsidy from the HHS levy to Metro Health for 2021, which is $32.4 million. The budget update for 2021 for the HHS levy contains substantial additions and revisions made possible by the passage of the HHS levy in the spring of 2020. We will hear from the Adams Board Director Scott Asicki, and then Director Walter Parfiowicz will make some brief remarks, after which HHS Director Merriman and the various departmental directors will provide a detailed presentation of the new and expanded services that are proposed in the 2021 budget update. I would now move on to the first item under number 4 and ask the clerk to please read resolution 2020-245 into the record.
Mr. Chair, for the record, I would like to state that Ms. Baker, Mr. Gallagher, and Mr. Tuma are in attendance.
Thank you very much.
Right. Resolution 2020-0245, resolution authorizing various sole source contracts with Manatron, Inc., doing business as Amentum Technologies in the total amount not to exceed $651,316 for support and maintenance services for various Manatron systems. And it's for the period January 1st, 2021 through December 31st, 2021.
Thank you very much. That resolution is now before us, and who on behalf of the administration will be presenting?
I will, Councilman Miller. Lisa Rocco from the Fiscal Office. So this is two contracts, one for MVP, which stores all billing information such as tax exemptions, border revision changes, tax increment financing, and produces a tax bill file. And also for our Sigma, which stores all county values and rate tables used for our sexennial appraisal. This is a sole source solely because this vendor is the vendor that implemented our current real property tax system. And the annual cost of the $651,000 is an increase of $31,000 from last year's annual maintenance, or 5%. Thank you.
Okay, thank you very much. Are there any questions by my colleagues? I would point out that this is the system that we are using until it's superseded by the Harris system, which is currently under development. My intention is that we will get an update on the Harris system on Monday, November 30th, the same time that we're doing the next update on the ERP system. We'll just do those together. The one question I would ask of the administration is whether there is any need that this legislation be passed on second reading suspension, or can it go?
Yes, Councilman, it can go, it's the full 3 reads.
Okay, and is there any change in the cost of this contract compared to what we're currently paying?
It's a 5% increase from last year, and that was a company-wide policy for all of their clients.
And are there any other questions by my colleagues at this time?
I have one, Chair.
Okay,
Just with the
Ms.
Harris,
Baker.
thank you. With the Harris system replacing this system, do we anticipate Harris replacing it any sooner than the end of next year?
No, we're on track for October of 2021.
Of Harris taking over the system?
Yes.
So there's still a couple of months left. This ends December. So is there going to be a time when we're paying both?
We have settled with Harris, and we are not paying for annual maintenance for 2021 for the Harris system.
Okay. All right. Is there any, at least as we know now, at this point in moving forward with Harris, any possibility that this could be done sooner, or any possibility that it could be done even into 2022?
It can't be done sooner. We're looking at going live with the first half of the tax billing for 2022. That's why we're doing October of 21. We don't want to start it in second half collection.
Got it. Okay, thank you.
You're welcome.
Okay, anything else, my colleagues? If not, would somebody like to offer a motion to move this resolution to the full council for second reading?
Conwell, I move this to the full council.
Is there a second?
Seconds. Okay.
Okay, it's been moved by Ms. Conwell and seconded by Ms. Simon to move resolution 2020-245 to the full council for second reading. Any further discussion? Hearing none, all those in favor say aye.
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 Any opposed? Hearing none, the ayes have it, and resolution 2020-245 is recommended to the full council for second reading.
Thank
So
you.
you're welcome. Okay. The next item on the agenda is the presentation of the 2021 budget for the Metro Health System. As mentioned further previously, the legislative authority of this council is required by state law to review and approve this budget, even though we have limited authority to amend it, and our allocation to Metro Health is done through the adoption of the budget update, which is, of course, being heard later today. So with that, I'm going to call on CEO Boutros to make the presentation.
Thank you, Mr. Chairman. I will share my screen as we discussed and go through the annual budget with you. Again, thank you for the opportunity. This was forwarded to you earlier. Here are the 2021 operating and capital budget highlights for the Metro Health System. We are looking to have an income target of approximately $60 million. That is a 4.1 operating margin, with an earnings before interest, depreciation, and amortization of $125 million, or 8.6% margin. The capital spend for routine and required and exclude any of the transformation dollars or any strategic capital is $40 million. This budget would create a maximum annual debt service coverage of 2.2 times. The maximum annual debt service is $63 million and will not come into effect until 2023. The current debt service coverage is 5.4 times. We expect by the end of the year to have unrestricted cash and investments of $601 million, which equates to 164 days of cash on hand. Here's a budget summary comparison. In 2019, we had approximately $1.3 billion in net revenues and expenses of $1.23 billion for an operating income of $67 million on an EBITDA of $125 million. The approved 2020 budget had a $1.3 billion total revenues with $1.27 million in expenses, so $56 million or $120 million of EBITDA. The 2021 target is $60 million with $1.45 billion of total revenues and commensurate increase in expenses for $125 million EBITDA. There are several opportunities for improvement, further diversification of our revenue, and to continue to look at new contracts that we've utilized since the COVID crisis occurred. Our population health and wellness initiatives for telehealth and hospital at home and other direct contracting, securing federal designation for the Metro Health system to protect against revenue erosion, and continual transformation improvements in the service lines and overall performance. There are some risks which I will go through, specifically the COVID-19 uncertainty and how that's going to impact the local economy and healthcare in general, decrease in utilization due to the pandemic shift and virtual care. There are some significant federal and state reimbursement reductions that have been scheduled that if implemented will have significant impact in the tens of millions of dollars of annual impact on Metro Health. Also some changes regarding pharmacy contracting that have been proposed by the pharmaceutical community. And there's also increased risk associated with us taking on additional risk for Medicare patients through the Medicare direct contracting model. Our 2021 capital budget is about $37 million for routine and required and strategic initiatives, and $2 million of contingency and $1 million for minor. Out of the $37 million, about 30% is for information technology, 30% is for continuing to hardening our facilities until replacement, and $40 million is for clinical operations. I know you are concerned about what is the macroeconomic impact of COVID-19 on healthcare, so I thought I would bring this to you. This is from Vizient, which is a national think tank, and in which most of the hospitals in the United States belong to. The virtual healthcare platform has accelerated by a decade. We were on our way to doing more virtual care, but that's been really fast-tracked. We are another step away from traditional employer-based health insurance, and we are moving towards much more responsibility by the government and individuals. The payer mix and volume shift to the uninsured and Medicaid will have significant impact on hospitals like Metro Health, as we have over 50% of the patients we care for fall into these categories. The Medicare funds are projected to be depleted by 2026, and changes in Medicare eligibility could accelerate that. We have transitioned and will continue to transition to lower low-cost sites, and there are some new market entrants that are proving to be highly competitive with hospital-based care. Nursing homes are becoming less useful as we get into virtual care, and there's significant growth in the hospital at home program. And today, for example, Metro Health has 20 hospital at home patients and expects that number to grow into the hundreds over the next couple of years. Expanded deployment of nurses and nurse practitioners and PAs throughout the healthcare system, as we have folks working at the top of license and ask pharmacists to give vaccinations, to be able to draw blood, to do other run tests and other things. And there's going to be this new era of healthcare preparedness. Metro Health, as I think most of you know, is the site designated by the federal government to care for significant disasters in our region. And most of our leadership, including myself, have been trained for a week long by the Department of Homeland Security and FEMA in Anniston, Alabama, for every type of disaster. We have over 100 people who are trained in taking that environment, but this now will become a standard for all healthcare organizations. And clearly the socioeconomic disparities that we are seeing and have expanded due to COVID are going to create their own challenges. This is important. In 2019, the average operating margin for our health system in the US was 3.5%. The expectation is that by the 2021, the average margin will be -4% to -7%. So that is a 7 to 10% margin swing. Metro Health cannot afford to go negative. We have $1 billion worth of bonds, and as such, we are committed to maintaining our operating margin to that 4% margin. And you can see the multitude of reasons why this is expected. This was done by the American Hospital Association, utilizing Vizient data and discussions with all the chief financial officers and chief executives of the health systems involved. So with that, I am happy to answer any questions, and I'll stop sharing, but can go back to any slide you would like.
So thank you very much. And I would like to take just a moment to recognize Metro Health's status as one of the premier and most important institutions in Cuyahoga County, particularly because of the important work that you do in making healthcare available to everybody, regardless of ability to pay, the important work you're doing in providing leadership on COVID-19, the work that you do with jail medical services for the county, and also with employee healthcare. So really appreciate your presentation, and thank you for all the very important work that you do for us in the county.
Thank you.
And with that, I would like to see if my colleagues have questions for CEO Boutros. Do we have any questions?
Chairman Miller?
Yes, please proceed.
Okay, this is Councilwoman Brown. The biggest impact was the pandemic, if I read that correctly, with a decrease in somewhere of 4 to 7 points.
That is correct. So
with that said, as we move towards conversations around vaccines, how do you anticipate that, how quickly you'll be able to recover from that?
Councilwoman Brown, I would just say is that The day we shut down on March 11th, we began our recovery plan.
Mhm.
So we started literally the day we decided to do shutdown. Metro Health so far has had $100 million in lost inpatient and outpatient revenues this year. That is not the end result of it. We ended up amplifying some different programs, working with the Department of Health and CMS to make sure that that didn't hit the bottom line fully. Otherwise, we would have furloughed and laid off staff. So we expanded pharmaceutical programs. We expanded programs with the Ohio Department of Medicaid. So we've curtailed most of the reductions so that we don't create a need for either reducing programs or coming to council and saying, we can't provide these programs. We need additional dollars. We're doing all our part to make sure that we remain financially strong. So I would say to you is our commitment is to stay at that 4% operating margin.
And the other question I would have is relative to the transformation project. What if impact has that had on?
None.
None. Okay.
None. We have not missed a day due to COVID, and we are. I'm happy to report we're ahead of schedule and on budget.
Okay. All right. Thank you, Mr. Chairman. Thank you, Dr. Boutros.
Good to see you.
Are there other questions from my colleagues?
Chair, I have a question. Nan Baker.
Yes, Councilwoman Baker.
Thank you. Thank you, Dr. Boutros, for being here today. We're all living in real time right now, and real time has started in March, and here we are in November, and we've had the cases of the COVID-19 increase, decrease, increase, decrease, and now we're on supposedly a surge that is statewide. So, we're hearing that the hospitals are concerned that they may not have enough beds, that their workers are getting are tired, and where are you? Where is Metro in this COVID-19 world right now that we seem to be on this roller coaster of probably at the highest peak right now that we've seen, even given all the shutdowns and all the restrictions and all the things that people are doing. Where is Metro in your capacity today, and what do you look forward to if things were to need hospital care?
So we are coordinating with the other health systems, just aware so that we are no longer looking at any of us as an individual case. The three major institutions, including also St. Vincent's and the VA, are trying to load balance all the community's need, which is, as I said in the beginning of this to Chairman Miller, this is unprecedented. So we today in Cuyahoga County have 470 inpatients and with COVID. That number can go by the end of the year between 1,500 to 2,000. That is the expectation. If nothing changes, by the end of the year, we will have between 1,500 to 2,000. The capability of this community, if they were to follow kind of the 3 W's, which is wash your hands, right? Watch your distance and wear a mask. We think we can tap that down to about 1,000. But that's what the best case scenario is. Will be about 1,000 inpatients by the end of the year. We can handle that between the 3 health systems. The clinic said, I think they are working at taking care of up to 1,500 patients. UH is looking to take care of about 900 patients, and we're looking to take care of about 250 patients. So we can do all of that, but it will be a strain if that happens. What it means is that other services, such as hip replacements and other things, may not be able to be done in a sufficient time and appropriate time. So we want to reduce that a bit so we can take care of all the needs that are non-COVID, along with COVID patients.
Okay, so if I may, Chair, so if I understood you correctly, we had a worst case scenario of 1,500 to 2,000. The healthcare systems that you are collaborating with, you would be able to manage that.
Correct. That would be a strain. It would mean we'd have to bring some things down. The most important thing also to know is that we're also now in the phase of working on vaccine distribution and allocation and all of those things. So as I said this morning on the joint press conference, there is a light at the end of this tunnel. And in March, there wasn't. There's actually a light at the end of this tunnel. We just need people to be a little bit more cautious, and we'll get there very soon.
Chair, if I just may, one more.
Please,
Different.
proceed.
Thank you. Different than we were in March or April or May. We certainly have learned a lot about this. Therapeutics certainly are part of the picture now. Hospital stays, I would think, are less than what they were. And the extreme cases, I think, are significantly less. And the death toll by rate is less. So do you see that? Is that included in the 1,500 to 2,000 cases? Yeah. Okay.
If the positivity rate and the numbers were back to March, we'd be talking about 5,000 inpatients.
Okay.
So everything is much better. We're able to take care. So we have, as I said, 20 COVID patients who are not even in the hospital, who could be in the hospital, that we're taking care of at home with our hospital at home program. So we're using all sorts of care devices to be able to keep people healthy and at home.
I appreciate your answers. Thank you. Thank you, Chair.
Okay, thank you very
Mr. Chair,
much.
Mr. Chair,
Yes,
can I have a
Ms. Simon.
follow-up?
Ms. Simon.
Councilwoman Simon, thank you, Mr. Chair. Dr. Boutros, thank you for being here. There's a line of thinking or thought throughout the country and the state, even the county, that there's really not a surge of COVID right now, and that perhaps it's because there's more testing that might skew the numbers. I wanted your opinion about that, whether in fact you have observed in your profession as a specialist and an expert if there's a surge, and is that separate from more testing? Thank you.
Councilwoman Simon, I'm happy to answer, but what's your friend's name?
Oh, that's George.
Okay.
Thank you. He's a Zoom, he loves Zoom and council.
Okay, well, let me state it this way, and I'll take May. May, for example, when we were testing about at Metro Health or the county about a third of the number of people that we are testing today, the positivity rate in our clinics and in our emergency rooms were somewhere around 12%. This past week, our positivity rate in Metro Health emergency room and clinic is 25%. Mm-hmm. So even though we're testing 3 to 4 times as much as we were testing in May, our positivity rate is going up. So I would just say to you is that I wish that it was just more testing.
Mm-hmm. Thank you. Thank you, Dr. Boutros.
My pleasure.
Other questions by my colleagues?
Yes. Council.
Vice President Jones?
Thank you. Dr. Boutros, thank you for being here today.
My pleasure, sir.
Yes. Well, first, I just want to take a moment just to publicly thank you for all you did for my father. My father went through that dementia. He'd been battling it for a few years, but he contracted COVID at the local nursing home. And we came to Metro, and they helped us through it. And over the course of several weeks, he survived that COVID. But it did leave him weathered, and my father passed in the coming weeks after that. He was not COVID positive at the time of passing, but it was certainly a factor that accelerated his passing. So my question to you is, do they keep, or do you keep statistics as well? We know about the deaths, but do we also know about those who've been impacted by COVID in the way my father was?
Yeah, Councilman Bernal, thank you for your kind comments and my deepest condolences.
Thank you.
Because of our Institute for Hope, we keep track of everyone who has been impacted by COVID and what has happened to all the social determinants of health, all their work, all their anxiety. For example, before COVID, approximately 40% of the patients said they felt some type of social isolation. After COVID, that number went up to 62%. So we keep track of everybody and have data that I think will help inform us in the future how to deal with these type of pandemics as they will happen. Just so we are clear, after this, we will have another pandemic. I don't want to be kind of Dr. Doom and Gloom, but they've been happening closer and closer over time. So we have to prepare for the next one.
Thank you.
Anything else?
Mr. Chairman?
Yes, Councilman Chun.
Yes. Doctor, you said that you were ready for the vaccines. Do we have that extremely low temperature equipment available in the area for the Pfizer version? My understanding is that has to be way down into the negative 80 or 90 degrees or even below that.
We have the capabilities, and I think we actually have a call now happening with the governor's office to discuss how we will be able to bring that to Cuyahoga County. Several of the organizations will become the point of distribution for Northeast Ohio, and we expect Metro Health will be one of them.
So at this moment in time, we do not have that capability of receiving the Pfizer vaccine?
We do.
We do or do not?
We do have it.
Oh, okay. I guess I thought you were saying it was being brought in from that standpoint.
We don't have the capabilities to have massive quantities, but we have it today to be able to receive what we think the allocated quantities are, and are currently building out capacity to do that.
So how many doses could we actually be distributing in Northeast Ohio?
Honestly, I don't know, Councilman.
Okay. And then there's always, I know that there's always a reference to the COVID cases and what it means financially. What does it mean if there's a COVID case that comes up and ends up being in Metro? What does that mean financially under the CARES Act? How much per patient?
I apologize. Are you asking about our reimbursement?
Reimbursement, yes, per patient.
Yeah, it is. This is the question about, do we get paid more for having a COVID case versus non-COVID case? Is that what you?
Yeah. Yes, exactly.
Councilman, I would not know. We don't worry about it. We take care of patients. We send out the bills. For us, we state the major reason the patient is in the hospital. If COVID is a contributing factor, it's a contributing factor. If it's the primary reason they're in, that's the primary reason. Honestly, I have not looked at what the dollar differential is. In the literature, it's talked about somewhere around 10 to 12% increase, somewhere around that. But for us, if somebody comes in because they have renal failure and it's getting worse and they happen to have COVID, we code that as a renal failure exacerbation. We don't code it as COVID.
Okay.
This is really important. We do not manipulate the system for gains. That's it.
Okay. Could you get the number as far as what it is worth then? You said you don't know it. I'd be interested to finding out what the financial impact is of COVID on reimbursement.
I will ask our CFO to tell us the average difference.
Thank you.
Anything else? Okay, thank you very much, Dr. Boutros. And we have the executive.
I just wanted to take one moment to let everybody know how helpful Metro has been during this pandemic. You didn't talk about it, Dr. Boutros, but first of all, the jail, the work you've done with testing and quarantining and everything else in the jail, you've made it so that our jail is an example for the state, as opposed to a good example as opposed to the other kind. Second is, we partnered with the Board of Health and Metro with respect to testing, particularly in underserved areas, and it's been a tremendous success. So I appreciate that. And finally, I just wanted to mention that we are working on yet another testing program with Metro. We hope to roll that out to council very shortly, which will involve rapid testing to help us further impact and hopefully put some control on this surge. So thank you for all of that, Dr. Boutros. You've been really helpful.
Thank you for the opportunity as a county executive. And as I think you may be aware, and this may be important to Councilman Gallagher, we had another discussion with the bench on Friday regarding the surge.
Yes, thank you for that, by the way. That I hope will be impactful. Thank you for that.
Thank you very much. We appreciate your coming in to present to us today. And we are now going to continue with the Health and Human Services review and ask Director Scott Osicki to come forward and speak on behalf of the Adams Board.
Thank you, sir. I'm going to share my screen. You can see that there. All right, so first of all, good afternoon. Thanks for having me. I'm Scott Osicki, the CEO of the Adams Board of Cuyahoga County, and want to thank Councilman Miller for having us here today, along with all of you, to talk about our calendar year 2021 allocation. So first off, I want to, trying to work two technologies here. Yep. Want to thank, there you go. Want to thank, we're grateful for County Executive Budish and his staff that submitted a budget that includes an increase of $4.1 million to the Adams Board base funding, and to all of you on council for your continued support, especially during the epidemic. We also want to thank the residents of Cuyahoga County who made this allocation possible by overwhelmingly supporting the increase in the Health and Human Services levy that was passed in April. And then this will bring our base funding from the Health and Human Service levies from $39,363,659 to $43,463,659. So I was asked to let you know how this $4.1 million increase will support things. So although, the increase was originally scheduled to be 5.1 million, but we totally agree with the decision that the county executive has made in providing the $4.1 million and understand, of course, the reasoning behind that decision. So we're going to use the funding to bolster our suicide prevention activities, provide treatment and recovery services for individuals experiencing a mental health and/or addiction crisis, and ensure that safe and affordable housing options are available for individuals and families that are living with mental illness and/or beginning their road to recovery with living in a sober environment. So I just wanted to show you some of the programs that we are thinking about. So the first is regarding community crisis services. So what we want to do is encourage and support the development of and sustainability of co-responder teams throughout Cuyahoga County. So the co-responder teams and law for law enforcement officers and behavioral health specialists to respond to calls at the same time and utilize the combined expertise of both the behavioral health expert as well as the officer to de-escalate a situation and then help individuals, link individuals with behavioral health issues and appropriate services. So the outcome of these situations can range from leaving the individual with necessary resources or transporting the individual to a hospital ER or psych ER or other places. And then it could also be leaving family members and others who are on the scene there with information as well. So we would seek providers through an RFP process to set this up. Currently, right now, we are operating a pilot program with the City of Cleveland through a grant that the City of Cleveland is funding, as well as we provided match opportunity there to expand it to all parts of Cleveland. So another thing we would like to do is to expand our crisis intervention team training to the entire throughout Cuyahoga County more. And how we want to do that is we would like to offer a stipend to each law enforcement agency to cover the cost of having the officers participate in the 40-hour training. Through discussions with police departments, they let us know that the cost of having officers cover the shift in CIT training is cost prohibitive, and sometimes they don't send the folks because of that. So we feel by eliminating this barrier, we can have more CIT officers throughout Cuyahoga County actually on the street able to respond to mental health or addiction crisis. Also, another thing we would like to do is we would like to add 4 dedicated crisis beds for children who are experiencing a mental health crisis, and that would bring our total number of beds available to 16 beds. And the availability of these beds is critical because it's a component to divert youth from higher levels of care, such as hospitalization. It can provide prevention screenings, treatment, and timely intervention. And it also expand our partnerships with area emergency rooms as well as DCFS for placing children as a bed as soon as possible. And we will utilize and issue an RFP process for this, as well as utilize some of our existing providers. We can also use this funding to provide such unique services such as outreach and spiritual counseling for victims of violent crime who often experience trauma, and then other such services that were recently cut from the Federal Victim of Crime Act, the VOCA funding. Another thing we would like to do, or we will be doing with the money, is that although a lot of focus has been placed on the epidemic that we're in, we're still living with an opiate epidemic, and we continue efforts to save as many lives as possible with that. This additional funding will be used to fund various harm reduction techniques, such as our fentanyl test strip program, and other grassroots efforts, including the launching of the Naloxbox program. And there is a picture there. And the Naloxbox program, what it is having Narcan available, as well as face masks and things like that to help people who are experiencing an overdose. So with this, it's important to note, though, that we don't condone or we encourage drug use, but we want to make sure we could save lives, as many as possible, so that person could make the decision to go into recovery. So what we would do is we would start with purchasing and installing 100 Nalox boxes in the community in various public areas, and areas where there have been high numbers of overdoses reported, as well as marketing and print materials and media buys for community outreach so people would know about these. And we have various programs, various partners that we have with this program. So we're looking forward to working with them as well. Suicide prevention. So before the pandemic, Cuyahoga County saw a largest number of deaths by suicide since 1985, and that was with 211 lives lost to suicide in 2019. So far, through September of 2020, 108 Cuyahoga County residents have died by suicide, and 88 of those have occurred since March, the beginning of the pandemic. We saw that in May, August, and September, those were actually the worst months for suicide, with 16 deaths occurring in each one of those months. Our partners are telling us that in recent weeks, They've seen about 26 visits per week in the emergency departments for possible suicide attempts. So we will also utilize funding for the continuation and addition of prevention campaigns that include direct social media and advertising that are geared toward certain demographics, various demographics, including the behavioral health and healthcare workforce, which are especially hit hard with the stress during the pandemic. And we can measure success of the campaigns on the number of impressions seen and the number of calls or texts to the hotline. We can also continue our service expansion plans, and that's important that we started last year with the additional funding, the $1 million one-time funding that the county gave us. And it's important to remember that crisis services are available to every resident of Cuyahoga County at no cost to them. We also want to we know that housing is a basic need, and without a place to call home, our clients could be living on the streets, in shelters, or moving in and out of homes, friends and family. So thanks to the one-time funding also that council gave us in the 2020 budget, we were able to reopen our residential assistance program and offer one-time mini grants to our adult care homes. And that was to provide needed repairs, appliances, mattresses, and other essentials to upgrade their homes to provide a safe and decent place for our clients to live. Through our diligent monitoring of the program, we were also able to place more clients on the residential state supplement program. And this combined with the new funding will allow us to continue the work that we started and to keep the program open for new clients. The new funding we're also going to use to cover the security deposits and open the housing assistance program to additional clients. That's HAP. And what that is, that's a temporary housing subsidy with private landlords where the clients living with mental illness and often with their families can select where they would like to live anywhere throughout Cuyahoga County. And they could either live in a single home, a duplex, multifamily units, or apartments. So currently with that, we're paying 60% of the rent and the client pays the 40%. We will also issue RFPs for new residential treatment services for both men and women, and the options and availability of the residential treatment are very important, so we can have those available when people exit detox or they're ready to get the help that they need. We would also like to utilize the funding to strengthen recovery housing, options for specialized populations, including women, pregnant women, women with children, youth, as well as transitional youth. So what we'll do there is we'll issue an RFP for new and existing providers to expand these housing options, as well as we'll also turn to our existing providers to assist with maintaining and ensuring that recovery housing for the specialized populations is available. So that's the end of the presentation, and I'll be glad to answer any questions that anybody would have. I'll stop sharing.
I would like to thank you very much for that presentation and say that the importance of the work of the Adams Board could not possibly be overstated. You're involved in so many things essential to the health and welfare of our community, and you're also heavily involved in the opiate crisis and the COVID-19 and the jail diversion and the disparity reduction. So it's very important work, and we're grateful for everything that you do. And I believe I heard Ms. Stevens, is that correct?
I'm sorry.
No, it was not, wasn't me.
Okay, who had a question?
Councilman Miller.
Please proceed.
Conwell.
Ms. Conwell.
Yes. Thank you. Through the chair to Director Osiki, how did and what specifically was the impact of the $1 million decrease in regards to services?
The additional funding, Councilwoman Conwell, that we received last year, the one-time
I
million.
know we talked about in several meetings, what that 5.1 would be spent for. So now that it has been decreased to 4.1, what specifically was impacted and how did you?
Well, what we really, not all of it has been impacted. What it would be is that it would just be the $1 million less to be spread across each one of those initiatives that I spoke about.
Okay, because I know there was a lot of housing and things of that
Yes.
really needed a certain dollar amount. So,
Yeah.
okay, so you're gonna spread it over. My second question would be in terms of the CIT training, what does that amount look like for the stipend?
But there's like, we haven't figured that out yet. It would all depend on either we would set one rate that would be across all police districts, or it would be based on the rate that they would have to pay for the officer. But we'll just start to figure that out.
Okay, and that'll be discussed at the board meeting?
Yeah, oh yes, correct. We would bring that up to them. Mhm.
If you could let me know that when you guys decide that.
Certainly.
And one other question in regards to suicide. When you talk about your data, is that inclusive of the county jail? What is that, when you look at that nationally, or I guess you're looking at Cuyahoga County as a whole and the suicide cases that are here? What does
Right.
that include?
It would be anything that was rated by the medical examiner as a suicide. And then the numbers were there were Cuyahoga County residents that passed away by suicide. If they lived in another county but died here, we did not include that.
Okay, thank you. Thank you, Chairman Miller.
Thank you very much, Ms. Conwell. Are there other questions by my colleagues?
I have a question, Ian Baker.
Ms. Baker.
Thank you. And thank you for your good work. I know there's a lot of need out there. A couple of things. Will you have numbers attached to each one of these proposals that you would like to provide in 2021?
No, we just started to put together looking at what we would be able to use the money for. So we'd have to have more of an in-depth look as to, each one of the areas. That's what you were asking, Councilwoman, I believe? Yeah.
Yes, I'm just wondering how we're going to do all of these programs if we don't know how much each of these programs are going to cost us.
Well, it would be that we know that's the 4.1 million extra. So we know we have that amount of money to utilize. So we would be able to put, budgets to each one of those proposals, each one of those programs, so that we would know that we just haven't had a chance to put that together yet.
Okay, I'd be interested to know.
Sure.
Well, there's been, even in our own budget, thoughts of cutting across the board for savings. And sometimes, we find that that's not always the best way, because there are some more important services that we need to provide than others, and we can't just across the board cut. So will you find perhaps like your crisis bed for children or other things or your housing that take more and perhaps the need is greater, that you would not provide a cut in those areas, but perhaps cut back on other things to make up for the $1 million that you are not going to be receiving?
So it's not actually, wouldn't be making a cut, right? So this was the additional 4.1. So that's how we know that we'd be able to get 4 additional treatment beds, crisis treatment beds for those. And I could get the number for
Well,
that.
I understand this is extra money, but the money was specifically targeted for
Yes.
specific things.
Yes, and those are the things that we have there. They fall into the categories of suicide, the crisis for mental health and addiction services, and the housing. Those were the 4 areas that we were requesting the addition in.
Okay. I'd be interested to see, when you get a little clearer picture of where these dollars are going, take a look at that. The opioid dollars that we received through settlement, are those dollars being used in your NALO box and community crisis services?
No, ma'am. These were addition to the 4.1 million. So the $1 million that we received in the one-time funding for the opioid crisis money, that money is already allocated to those specific programs.
Okay. I did have one further, let me think here. The VOCA funding.
Yes.
That VOCA funding, the cut from the federal government was not part of this program at the time that we asked for funding for the HHS levy. So that is actually adding to your list. Is that true?
We were considering that part of crisis and perhaps part of residential. Right now, we're doing a pilot program for 6 months with a trauma collaborative. I can't remember the exact name of it, but it was originally funded through the Center for Families and Children, and they did not receive that funding, and they no longer wanted to participate in that program. So we're going with another organization, and that's for 6 months, which is out of the funding that we currently have for in our regular budget. And then that's what we're looking towards at the end of that 6 months period to see if we could continue on funding that program, or perhaps even expanding it, because it was trauma for people with violence. And some of that also involves housing in safe houses. And right now we're not funding that portion of it, but that would be something that we would look into then also, because it would be part of the housing and crisis services.
So you were thinking of doing that regardless of whether or not VOCA funding was cut from the federal government?
It came to our attention because of the VOCA funding cut.
Okay. And lastly, the crisis for beds for children, was it always going to be 16 beds, an additional 4, or has that been cut?
No, we could have went more. Yes, we could have probably added another 8 beds actually if we would have had the other $1 million. But that's why we are doing with the 4, considering how much we would be able to spend.
Okay, good. Thank you, Chair. Thank you, Director.
So to reinforce Ms. Baker's question, I would like to see a preliminary estimate of how you would allocate the additional $4.1 million among these various programs before we have to vote on the final version of the budget.
Okay, yes, sir. I could get that over.
Okay, thank you.
Mhm.
So other questions by my colleagues? Okay.
Yes, Councilman.
Yes, you got in under the wire, Vice President Jones.
Thank you. It's always a challenge trying to hit that mute button.
Oh, okay, I understand.
All right. Scott, I had a question. My question revolves around the crack and fentanyl. Roughly a year ago, we know that fentanyl was being introduced into crack, cocaine, and they looked identical. One with crack with fentanyl and crack without fentanyl looked identical, and that people in the community were using this laced product, and they were dying as a result of it. If I remember, there was a moment when there were 20 people who died in 20 days about a year ago. Can you speak to that subject and where it is now, almost a year later?
Yes, sir. Yes, that is still a big issue, especially in the African-American community, where the dealers are putting in fentanyl. They are cutting it they're cutting crack cocaine with the fentanyl. So they are people who are taking it. If they don't realize what they're taking, it could be a death sentence for them right away, like you were saying. So that's why we have our fentanyl test strip program, and that's really a good grassroots campaign. Our staff actually goes out into the community to look for near overdoses or fatal overdoses were in the community. They stop in gas stations and corner stores and laundromats and beauty shops and hair cutting places and ask to see if we could put this out for them. And 99% of the time they take that. So once again, this was that we weren't condoning drug use at all. There's a message on there for that, and also getting help. But we want to make sure that people know what they're doing, and then if they can make a decision to get treatment. But it's about saving lives. but yes, it still continues. And we're also going to be doing some targeted campaigns to certain demographics to make sure that they know the dangers. And beyond just putting it in the cocaine, they're also pressing fentanyl into tablets as well. So it may look like something else, and people don't know that it's actually fentanyl.
Okay. You mentioned your grassroots efforts within the community. What can the community do to help to be a part of the solution in terms of, as you reach out, what can they do in response to help?
Yes. So, like with our social media campaigns that we have, they could spread that, to their friends as well, to reach as many people as they can. The faith-based community, they're helping us out, also get the message out to their congregations. And people could look on our website for information that they could share. And if somebody wants to participate in that fentanyl test strip program, they could certainly contact our office and we could get them involved in that. But the nice thing is getting the messages out so people know that there is a danger.
Okay. All right. Thank you.
Okay. Any other questions? Okay. Thank you very much. We appreciate everything that you do.
Thank you. We appreciate you too, all of you. Thank you.
Thank you. Okay. We are now going to call upon OBM Director Parfiowitz and HHS Director Merriman to begin the presentation on the HHS agencies, and then we'll continue on to the specific directors for specific programs.
Okay, Councilman Miller, Walter Parfiowitz from the Fiscal Office. I'm about to share my screen, and I'll start with where we left off last week with the continuation of the 2021 budget update. Okay, can everyone see my screen? Okay, this screen outlines the Health and Human Services Levy Fund. We'll just start at the top for 2021. The Health and Human Services Levy Fund is anticipating an operating surplus of $8.8 million. Revenues projected to total $287.3 million, while expenditures are projected to total $278.5 million. So just quickly to go over the revenue side, property tax revenue generated by the 4.8 mills and the newly approved 4.7 mills levies projected to total $270.4 million. This is $35.4 million more than the adopted budget. And the levy subsidies, they're projected to total $278.5 million. This is $29.1 million or 11.6% more than the adopted budget. In addition to some minor technical adjustments, this increase includes $1.2 million for increased healthcare costs, $1.1 million for workers' compensation costs, and $24.2 million in additional subsidies to HHS departments. Additional HHS levy subsidies include, let me just flip the screen to the next page. The middle column there labeled budget adjustments. Keep in mind that these are an accumulation of the budget adjustment for the additional levy subsidy, inclusive of the healthcare increase, the workers' comp increase, and some minor adjustments. The additional levy subsidies include, as we heard from Scott today, $4.1 million for the Adams Board for those who can't be served with opioid settlement funds, $750,000 to the Division of Job and Family Services to hire additional caseworkers, $3.3 million to the Division of Children and Family Services to implement a kinship care program, $2.6 million to Division of Children and Family Services to fund Say Yes to Education, $500,000 to the Division of Children and Family Services for a drop-in center, $1.5 million to the Division of Children and Family Services for a child care center, $2 million to the Division of Senior and Adult Services for additional services to seniors, to eliminate waiting lists, provide meals during the holidays, hire additional family service aides and geriatric specialists, and also to expand senior transportation. $5 million to the Office of Early Childhood to expand UPK and the number of slots available. $750,000 to the Family and Children First Council to implement crisis coordination, increase out of school time programs in additional neighborhoods, and increase the FAST program, the Families and Schools Together program. $2,175,000. I'm sorry. Yeah, $2,175,000 to the Office of Homeless Services for permanent housing. $500,000 to the Office of Reentry to support employers who hire reentry clients. $250,000 for the Equity Commission. $500,000 for Lead Coalition. And then $280,000 to 7 partner agencies who lost VOCA funding, each to receive $40,000. And then finally, a $5 million repayment to the general fund. Just go back one. This year we added a reserve on the balance of $15 million for COVID-19 mitigation. We're assuming that we're not going to receive CARES Act funding in 2021. This brings our ending cash balance in the levy fund to be projected at 29.7 million, which is 10.7 of expenditures, and this is in compliance with section 706.01 of the county code. I can stop here and answer any questions before turning it over to David for some departmental presentations.
Are there any questions for the director?
Yes, this is Councilwoman Brown.
Ms. Brown?
Thank you, Chairman. You touched on the slots for UPK.
Yes.
Can you revisit that for me for those numbers?
I don't have the number of slots, Councilman Brown. My notes just, we talk about expanding UPK and the number of slots available.
Okay.
I believe Dr. Dorman will present on that shortly.
Okay, so I guess I can hold my questions until after the presentation. I was just curious, given our current circumstances. I'm eager to learn how those slots are being occupied and if there are any vacancies.
I don't have any detail. I'm sorry.
Okay, all right, I'll wait. Thank you, Chairman Miller. I'll hold my questions.
So, Director, there was one item on the spreadsheet that actually showed a reduction of a little bit over $2 million in a budget adjustment for the juvenile court. Could you explain that item?
Yeah, I'm sorry, Councilman Miller. That's actually moving a common pleas accounting unit out of the HHS levy into a special revenue fund. It should have never been set up in this levy account from day one. It's been in here now. It was moved last year's budget. Now we're moving it again this year's budget. It's going into special revenue, so it looks like it's going down.
Okay, fine. Anything else for the director?
I'm sorry, I'm mute.
Okay, Ms. Baker.
Thank you. The 1 million that was going to be targeted to the Adams Board, which was decreased from 5.1 to 4.1, where did that extra million go? Can you tell me in this list how we reallocated those dollars?
I do not have the detail, but I think in the end, we didn't allocate the full levy here. We left approximately $5 million extra overall.
Overall, okay, so there's 5 million excess of funding.
Right, the levy brought in 35, and what we have here is 29.1.
29.1 and 35, okay. I know there's been some talk about the Say Yes to Education and that was perhaps not factored into the HHS levy in the original form. Is that true, or has that always been 2.6 million?
It's always been intended to be in the levy. It just wasn't budgeted properly.
So how did we make up that 2.6 million then? Especially if we have 5 million excess in funding and $1 million of the Adams Board money didn't go to them. I'm just curious how the 2.6 million get factored in if it wasn't considered or overlooked, I should say.
That's a very good question. Councilwoman Baker. Let me take a look at that and see if I can get back to you on that question.
Okay. And if you don't mind, Chair, just one final. Is there any other items on this list that were increased or decreased or even eliminated from the original, what we thought we would need the 35 million for?
I don't think anyone was increased. These are primarily decreases.
Okay. Then if I may follow on, why would there be any decreases?
I believe just to reallocate the overall for Lost VOCA and some of the other programs. We have 1, 2, 3. We have 7 entities receiving funding this year
Right.
that lost VOCA funding. Yeah, it's not. I mean, it's $280,000 overall. Still significant. Things
Right.
that weren't planned were Equity Commission led coalition. The Office of Reentry, I don't believe was initially planned for.
Okay. Well, we still have a $5 million excess carryover,
We do.
and we didn't give $1 million to Adams
Yeah.
Board. So I guess if you can give me some explanations there, I'd appreciate it, just to see how the money
Yeah, I will.
broken
I'll
down.
provide the initial and compare it against this.
Perfect. Thank you. Thank you, Chair.
So to Ms. Baker, one thing that I would add is part of the reason for the leftover money is the desire to manage the levy over the entire 8-year cycle so that we don't have to go for another tax increase in the meantime. And because the levy funds are fixed, but the costs they go up every year because of inflation. In order to do that, we have to hold money back in the first few years of the levy cycle and then use those reserves to cover costs in the later years of the levy cycle. So that's one reason why it's budgeted this way.
And Chair, if I may ask, was that always the intention? This levy was always going to be holding back in the first few years and then increasing as we went? I don't remember that being part of it. I thought we were 8 years. This is what we needed for 8 years, and these are the programs we're going to be funding.
I believe that aspect was discussed off and on throughout the levy process. It's just what's needed to manage a fixed source of funds in an increasing cost environment. If you don't do it that way, then you're going to spend all the money the first year. The second year, you're going to be 5 million in the hole. The third year, you're going to be 10 million in the hole. And before you know it, you're out of reserves and have to go for a tax increase.
Oh,
Chairman.
okay.
Yes, Executive Budish.
Just to Councilwoman Baker, to agree with Councilman Miller and to say that when we first proposed the levy, we had $5 million slotted for inflation. That's what this is, but that was originally anticipated.
And those inflation dollars are not included in these numbers? I thought that they were.
The additional dollars.
Okay. Chair Miller, weren't the inflation dollars already factored in or no during our discussions of this budget?
The inflation dollars are embedded in some of the items that are in the budget, such as the increased cost for workers' compensation and for healthcare. But when we had the preliminary discussions prior to passage of the levy, in which we talked about where the additional $35 million was spent, there was a $5 million item included that the executive referred to for inflation for planning purposes. But when we get to actually preparing the 2021 budget, the inflation for the coming year is embedded in some of the other budget numbers, but we have to hold back some money so that we'll be able to handle the additional inflation that's going to come in the future years.
Okay, thank you for that explanation.
Any other questions at this point, or can we proceed to the specific agencies? Hearing none, we'll proceed.
Well, great. Then I will move forward, if that's okay, Councilman Miller. I'll begin.
Yes, please proceed.
Wonderful. David Merriman, I'm the Director of Health and Human Services, and I'm joined today by Kathy Starks, who is the Fiscal Officer for the Department of Health and Human Services. I first want to thank council members and staff for their feedback, some good questions, and ultimately the opportunity to present this, to do this presentation today. We've anticipated there will be questions, so our focus will be to briefly describe our new programs and reserve time for discussion. We'll largely follow the order of the items that are presented in Director Parfialitz's document. We will be making a few changes in that order to accommodate staff, one of whom is out right now in a medical procedure, but is going to join us later in the presentation. I'm going to begin. I'll start with the Director's Office and our HHS admin. I do want to remind council that we operate a shared service model where our fiscal and administrative services are pooled to enable federal and state grant reimbursement. These include our fiscal office, contract administration and performance, client support services, communication, and our program evaluation and innovation, as well as training and performance. These programs are included in the director's budget. I think Walter has reviewed that there was a technical fix and some adjustments made to account for benefits. So you will see that there's a listing for child support as well as DHHS Information Services and Human Resources, as well as HHS Administration. Each of the budget subsidies presented for those areas are the technical fixes. We are simply adjusting for increased cost of benefits. I know that Walter's already reviewed these with council, so we won't dwell on them. I do want to take a couple minutes and describe the new programs that have been presented, maybe not in the order that Walter described them. I do want to begin with the first new program that wasn't referenced. The drop-in center is actually listed as part of the DCFS budget, but I have to recognize that this is as much a program of the Office of Homeless Services as well as Family and Children First Council. So I'm going to take the time to briefly describe how the drop-in center for youth experiencing homelessness is a program that will create a comprehensive, tailor-made mechanism for engaging young residents to reduce the barriers that they're experiencing to just engage with our existing services and to allow them to function more effectively. Cuyahoga County is the only major county in Ohio without a homeless youth drop-in center. There is a very, very well-established program in Columbus called Star House. Cincinnati has a program. Franklin County has a program. And this is not to say that because they have one, we should have one, but more importantly, a recognition that young people experiencing homelessness are disproportionately more likely to be minorities. They're more likely than their peers to be unstably housed and unable to access public assistance. More than 62% of youth experiencing homeless in Cuyahoga County have prior involvement with the child welfare system, or 38% have involvement with the juvenile justice system, and a third have been involved in both. In 2018, there were 1/3 of all youth presented for emergency assistance did not follow up and get a shelter referral. So they come for benefits, but unfortunately we have no idea where they're being housed. And so we really are very concerned about how those youth that enter shelter, a portion leave and just disappear to us, and we know they have significant needs, and we do not want them to become lost to the system. We also know there's approximately 100 youth every year that age out of the foster care system without a dedicated support or emotionally invested permanent family for them. So we believe that the county investment in this youth drop-in center will enable us to more effectively address the needs of these young people, hopefully to divert them before they have an intensified need. And although, as I said, this program is listed in the DCFS budget, this is a cross-departmental program with leadership coming from both child welfare, homeless services, and increasingly the Family and Children First Council. If it's okay with the chairman, I'm going to present the other new programs and then pause for questions, unless you'd like me to pause after each of the new programs.
Let's go through the programs.
Wonderful. The next is it's listed as the Lead Coalition, but this is the Lead Safe Home Fund. And we are supporting this new Lead Safe Resource Center that will be a resource to all of the community. It'll be providing community education and access to new lead poisoning prevention hotline for multiple jurisdictions. This investment in the Lead Coalition or the Lead Safe Home Fund will also support training and certification of contractors in lead safe practices, such as this is a recognized certified contractor to do work like lead abatement, risk assessment, and ultimately other construction work that will make homes safe. We believe that this investment is a very direct investment in workforce development opportunities, and that lead contractors are going to be available throughout the county as a result of it. We do have a long-standing role, the county does, as does in the Lead Coalition. I also just want to recognize that Terry Allen, the Commissioner of Health for the County Board of Health, has also been instrumental. He sits on the Coalition Steering Committee, and he, as well as the Office of Early Childhood, co-chair the Screening and Testing Committee. So our funding will largely support Lead Safe Cleveland Coalition to build out the resource center to support lead abatement workforce development. The other two items that I just want to recognize, and then I will open up for questions before moving on to the departments, is the Equity Commission. The fund presented here will enable us to fund program implementation for the Cuyahoga County Equity Commission, which I am a member of. The fund will support priorities such as staff training, race, equity, and inclusion, outcomes analysis, and other projects that are developed through the Equity Commission's review of existing programs and services and identification of areas for improvement. We also work extremely closely with the Citizens Advisory Council on Equity, or CASE. I want to take a second and acknowledge Councilwoman Brown's involvement in this work. We've had conversations with her. We understand that there is an expectation that we move to implementation, and we share that view. The meetings that we have where we discuss our program services and improvements are hosted by the county's website. They do follow public posting expectations. So we expect more detail to follow as to how we will be using these funds. The last area is to just recap some of the discussion that's already occurred as it relates to VOCA replacement. We will be coordinating with the Adams Board and are proposing a response to major cuts in the Victims of Crime Act program, VOCA. VOCA is administered by the Ohio Attorney General's office. Programs were expected to see a 10% reduction in VOCA funding as a result of policy changes at the federal level. They ended up getting a 37% cut. It's a very dramatic impact on many program budgets. Unfortunately, these cuts came at the same time that many were also experiencing the impact of COVID on disruption of operations, as well as their ability to raise funds. So what we are proposing is a one-time allocation to help sustain services through these cuts. We do know that there will be additional cuts made in the future, so this is not something we can commit to forever. I do want to also just recognize that I am working very closely with Catherine Tkachik to coordinate our response to these cuts as they relate to the COVID impact. We are looking at if or how CARES funds can be used to address some of the increased programmatic expenses, as well as the reduction in revenue due to a loss of events and fundraising opportunity. So Chairman, those were the four programs that I wanted to begin with discussion on. I'd gladly pause here to take questions. When we're done, I'm going to move to each department and ask them to do a brief presentation as well.
Okay, thank you very much, Director. Are there questions by my colleagues? Hearing none, we will ask the Director to move to the first department.
Thank you.
Mr. Chair, I did have a question. I'm sorry.
Councilman Tron, or no, Gallagher, sorry.
Mr. Merriman, you mentioned because of COVID, where is that money going for the one time this year?
There are 7 organizations that will be receiving additional a one-time levy allocation. They are the Cleveland Adoption Network, the Renee Jones Center, the YWCA of Greater Cleveland, Juvenile Court Witness Victims, the Domestic Violence and Child Advocacy Center, East Cleveland Domestic Violence Program, and the Canopy Child Advocacy Center.
What's the total on that?
So for those 7 programs, they're $40,000 each for $280,000.
And why didn't we put those in the COVID basket that we received the CARES funds for?
Some are, Councilman, and that's where I'm working with Catherine Tkachuk. Some have had very, very significant disruption of services or increased services. And so we have co-funded some of them, if I may. The Child Advocacy Center is getting both CARES dollars as well as levy dollars. The Domestic Violence Center is as well. The YWCA is getting CARES and levy dollars. And so then there are other CARES dollars going to other programs that have been impacted by VOCA.
Okay, thank you.
Thank you.
Chair, if I may ask before we
Ms.
leave.
Baker,
On the Lead Safe Resource Center, where are we in the fight against lead? We've been talking about that for a long time. I know there's other entities out there, the City of Cleveland and other organizations, all working toward trying to eliminate lead paint that's in homes. And I'm not sure if this also carries over to lead pipes that contaminate water. Where are we in this fight to make sure that especially these children aren't exposed to lead contaminants?
So, Councilwoman, it's a very good question. There is work going on at multiple levels. The proposal in front of you today is to focus on the Lead Safe Home Fund and largely to support the operation of the Lead Safe Resource Center that really provides a lot of community education as well as a new lead poisoning prevention hotline that will be open to anyone in Cuyahoga County. The policy questions that you've asked about in terms of reducing lead exposure through, I suppose there's a number of ways to do that from a policy perspective, is not the specific focus of this proposal. This is much more on services, helping to address the needs of residents that are living in homes that have been exposed, landlords that have homes that need to be remediated, and then communities that have a disproportionate share of those homes. And lastly, the workforce that is needed to be trained to be able to enter homes, to assess homes, to remediate the lead poisoning or the lead exposure in those homes. And so this proposal today is more focused on addressing community and resident need. And I know there's great work going on in the state to look at more policy around this that are, I think, a little bit more in line with your suggestions.
If I may follow up with the focus on lead safe practices, do we have any kind of a timeline or any result driven? This is what we've been able to accomplish up till now, given the years really we've been talking about the lead and the harm that it causes in our children, even being behind in school because of it. Where do we have the successes of what we've been able to do and what we're going to be building on to eliminate all of these older homes that contain lead?
So it's a great question, Councilwoman. If I may suggest, maybe this is worth a separate presentation to council, simply because the coalition that's in place has done an excellent job of braiding together various local funding sources. And much of their work has really been to recognize the damage and the impact of lead and to propose solutions and a coordinated, integrated response to the problem. So I think it probably would be a good use of our time to bring them back, to have them present in greater detail answers to some of your questions.
Okay, I appreciate that. Thank you.
Okay. Councilman Miller, I'm going to move forward and I'm going to introduce Kevin Gowan. Kevin will be presenting on Job and Family Services and the $750,000 that has been proposed for their services. Kevin, are you on at this time?
I am here.
Okay.
All right. Hi, thank you, David. Like David said, I'm Kevin Gowan, the administrator for the Cuyahoga County Job and Family Services. Briefly, Job and Family Services is responsible for public assistance programs. Our caseworkers in Cuyahoga Job and Family Services determine Cuyahoga residents' eligibility for public assistance. These benefits include Supplemental Nutritional Assistance Program, or SNAP, which is formerly known as food stamps, the Medicaid program, the Cash Assistance Program, subsidized child care program, and our prevention, retention, retention, and contingency program that handles emergent needs. The bulk of these clients access our services through our eligibility contact center, which services Medicaid, the SNAP program, and the CASH program. The number of people receiving these benefits represent the bulk of the population served by our agency as well. There are currently 220,000 people who receive food assistance in the county. There are 406,000 people who are on Medicaid in the county, and there are 11,000 people receiving cash assistance. In order to serve this population, the agency answers on average roughly 52,000 calls per month. However, we normally receive over 70,000 calls. The agency has, during the pandemic, increased its productivity despite essentially static levels of staffing at that time, during this time. We also restructured in February of 2019 to increase our effectiveness in handling these calls, reducing wait times by roughly 50%. We have also instituted performance tracking systems that give our leadership team the ability to track individual performance levels remotely. And during the past 7 months, we have further developed these tools. And as a result, we've actually seen, as a result of this, and of, quite frankly, the team's embracement of the virtual environment, our productivity has gone up. During the pandemic crisis, our overall SNAP and Medicaid application caseloads, however, have increased by 10% each. If that situation persists, we perceive that trend continuing. During this time, we have been able to keep up with the casework. Our actual timely processing of applications, has improved. This is a federal measure, and it has improved markedly since April. The phone volume, however, continues to be high. And while we have done several things to address efficiency, improved our efficiency and productivity, it's clear at this point that increased staff and increased resources are necessary to get to all the phone calls. So in order to increase our capacity to handle the call volume, we'll be using the additional $750,000 to hire 15 new caseworkers. This will increase our call capability by approximately 4,000 calls per month. That will all have the domino effect of driving down wait times and driving up our overall answer rates. I'm happy to answer any questions at this time.
Questions for the director?
Chairman, Councilwoman Brown here.
Yes, Ms. Brown.
Director, just curious, the last comment you made with driving down wait times and increasing the call rate. What are you currently, and what is that goal? What are you aiming for?
So our current in October, the last month that I have data for, we've actually experienced a significant increase in our case volume. Mm-hmm. And I'm sorry, I thought I had this up. Just give me 1 second.
And to that point, if you could just illustrate for us the increase in case volume that you've experienced since COVID and compared to where you are now.
In October, we saw our overall, and I will get to your next question, yes. So overall wait time actually went up to 23 minutes in October. During the pandemic, in the initial phase of the pandemic, we actually drove it down to historically low levels. And we actually down to 2 minutes at the height of the pandemic. Part of that was due to federal waivers where we were essentially addressing only new applications. Those waivers were removed. In addition to that, they actually doubled the amount of work through some changes at FNS in September and October, which drastically increased our volume of work. The current caseload of over 406,000 Medicaid, I think I'm answering your question here, compares to roughly 370,000 people on Medicaid prior to the pandemic, 220,000 people on SNAP. There were right around 200,000 people on SNAP prior to the pandemic. So we've added 20,000 and 37,000 to the respective programs. Does that answer your question, Councilman Brown?
Yes, that answers it, but it also, and if you could share those data points with us as well, if you get them to the clerk so that we can look at those, because I think it tells a part of the story that we don't get to hear very much about. And if the wait times are increasing, then that signals to me there are a significant number of people out there that are still not being serviced. And so just would like to take that into consideration as this body has to make decisions. So thank you very much.
Certainly. I will throw in that the call volume has increased more so than the case application volume. I think that is largely due to the general atmosphere that's around the community right now. We get more phone calls around less cases than we used to. So the call volume is up more so than the case application volume.
So just for my clarity, can you make the distinction a little bit more clear for me? So call volume is up, but cases aren't. So when the people are calling, what are they calling?
This is a recent development, and I'm actually engaged my team to try and figure out why the case volume is remaining relatively static. And I mean new applications as opposed to overall. The overall caseload has gone up. New applications as of late has not gone up, but the volume has gone up more so. And so I'm reaching out to my team to engage at the worker level to try and figure out why that's happening. My immediate guess is that people are, that this is now 7 months into a pandemic and people are just worried about making sure that they have the resources they need as they face the pandemic.
Is there any relative correlation with rejection rate, if you will? Do we know the call? So do we track that information?
Yeah, the denial rate is roughly the same as it was prior to the pandemic. Yes.
Thank you. Thank you, Mr. Chair.
You're welcome. Any other questions for the director?
Conwell?
Yes, Ms. Conwell.
Through the chair to Director Gowan to follow up on Councilwoman Brown's question. Can you illustrate for us how during the COVID-19, during the pandemic, how are the residents or have access to getting their information in, like their applications or whatever else that they need? Since the building was closed at a time, how are the different avenues and access available for them to be able to put in that they need a need?
So
other than calling.
Yes, so they can call and they have been. They can also apply online. There is a benefits portal they can use. They can mail in an application. Our mailroom is still operational. They can use a drop box at any one of our neighborhood family service centers to drop off an application. They can also pick up a paper application there as well. So there's those methods existed prior to the pandemic, and were actually the primary means by which people access service prior to the pandemic. The only difference is that our lobby is restricted. We are right now seeing clients, but it is very limited and only at the Virtual Brown building.
Are you breaking down the different numbers of how you're getting the applications, the new request, like with calls and mail and all that?
Yeah, yes and no. Unfortunately, that information isn't available to me in a report. I have to rely on the data systems available to me. I do have numbers on the phone applications. That does depend on the clients properly picking when they're in the phone tree. But I can't tell how many phone applications we get. But the overall application data and a breakdown like you're asking for, it's not data that I have access to right now.
But you do have it.
Pardon me?
But you do have it.
I
just don't
don't
have access to it now, but you do have.
I have access to the phone information, but I do not have access to a breakdown versus online versus paper. So I can tell you what, I will follow up with the state again and see if we can get more detailed information on that.
Okay, but when they, for example, when they drop it off, say they drop it in our Dropbox, we're not keeping that data of how many are applying.
We're not tracking. Our primary focus is to get all the information into the system. We receive applications is one of the many things we receive through the Dropbox or through the mail. A lot of it is actually supporting documentation they have to submit after they apply. So we do not have a systematic breakdown of which venues the applications are coming from.
Okay, I just thought maybe that might go with the correlation of why phone calls are up, but people aren't applying or how it correlates. So if we could take a look at that in the future.
Certainly.
Let me know if it's hard to do. Thank you.
Yes, I will. Thank you, Councilman.
Mr. Chair, if I could follow up on Councilwoman Conwell's questions, Chantel again.
Yes, Ms. Brown.
Thank you. So given the fact that we aren't tracking that data and there has been a very distinct and disparate digital divide in as it relates to the urban core, students not being able to get access to Wi-Fi, inability to have computers, I think it's critical to the narrative to be able to determine how people are getting to the resources. Because again, if we're highly dependent on people applying for these services online and they don't have access to that conduit, then we're deceiving ourselves if we say that there are less cases and more calls. I just don't think that the correlation matches the narrative. So I think it's important that we really did do a deep dive into that, Director, because people are clearly suffering in some of our communities more than others due to this pandemic, and to sit before us and to paint kind of a picture that things are not as bad as we may seem, or that things are better than they may look on the surface. I'm not confident that that would be an accurate assessment, so I just urge you to really reevaluate those things, please, because there's a clear disconnect.
We'll take
if I could just say that, on behalf of DHHS, our buildings have actually been much more progressive about reopening to allow visitors in, to some extent for that specific reason. We acknowledge that there are people in this community that, regardless of whether or not they have access to a computer in their home, they may not have the ability to use an online system or the patience to wait through a phone system. And really, it is for that reason that JFS opened its lobby when it did, to be able to give the community an outlet. And the same can be said of child support. And so although they're not on today, I think we made I think in some ways a difficult decision to allow people into our building to facilitate cases when someone doesn't have the ability to work through an online system or a phone system. And I think our hope is that at the end of the day, giving the residents that opportunity is critical. That being said, with this current trend of cases, I'm not sure how long we'll be able to sustain that, because there are a lot of concerns about the number of people that are coming in. But I do think it's a fair point, and it's something that we're talking about on an ongoing basis of, you know, if our system is more effective for 80% of the population, what does it mean for the 20% that maybe don't have the same resources?
Thanks for chiming in, but I think it only heightens Councilwoman Conwell's point that we need to track that data on how the applications are being processed. Thank you very much.
So,
Thank you.
reinforce what my colleagues have said. We need to have good information on the various ways that people are accessing the system, and also whether there's differences in the way that access takes place among different population subgroups, so that our idea is to have an open door, and we don't know if we have an open door unless we have good information of that kind. So I would reinforce the request of my colleagues to work on putting together that kind of information.
Okay.
Any other questions for Director Gowan? Okay, thank you very much. I'll ask Director Merriman to call forward the next director.
I'm going to ask for the Department of Senior and Adult Services, Tracy Mason, to come forward and ask her to present on the increase in program budget that she has. It's nearly $2 million. Tracy, are you on?
Yes, I'm present. Good afternoon, everyone. First of all, I want to thank you for your time today. I also want to thank the Cuyahoga County residents, our county executive, for continuing to support the needs of older adults and adults with disabilities. As our country and our county, we're seeing a steady and significant growth in numbers of older adults and adults with disabilities. In fact, according to the Centers for Community Solutions, there are over 300,000 older adults living in Cuyahoga County, representing 24% of our population. And projections indicate by year 2030, older adults over 65 years old will outnumber children and teens under the age of 20, representing a new majority. To maintain and sustain this steady anticipated growth, DSAS must continue to build its core programs and services. Our strategic priorities are aligned with the social determinants of health, which are conditions that shape our daily lives, from where we are born, to where we grow, to where we work, to where we live, and how we age. DSAS is particularly focusing on food insecurity, housing, transportation, behavioral health, and reducing social isolation. To that end, DSAS is proposing to allocate $2 million of additional funding to support strategic priorities in 4 core areas. Expand our Options for Independent Living program, which provides person-centered services to assist older adults and adults with disabilities to maintain their independence in their home. The Options program is designed to fill a gap in service for those who do not qualify for Medicaid waiver but still need assistance. We plan to allocate $990,000 in 2 ways. One is to partner with our contract providers to provide more than 31,000 meals, 15,000 personal care and homemaking hours, and more than 10,000 rides for medical services. And more importantly, continue to add seniors to our Options program without a waiting list. Also, we will add 2 positions to our Options program to support the anticipated growth in caseload and service activity. We will also expand our Information and Services program, which provides case management services to help navigate available resources around housing, food insecurity, benefits enrollment, and other wraparound services. DSAS will add 3 positions to manage the growing caseload, totaling $230,000. Thirdly, we will increase our Emergency Assistance Fund by $100,000 to expand our on-site food pantry to address food insecurity, provide housing and utility assistance, and other services to stabilize older adults and adults with disabilities. Many older adults are making difficult choices between paying, whether it's their rent and mortgage, paying for food, medication, home repairs, and other basic necessities. Lastly, our community social service program, where we partner with senior centers throughout Cuyahoga County as contract providers to reduce social isolation and provide health and well-being programs and services for older adults and adults with disabilities. In light of COVID, many of our partners have had to pivot their services from congregate meals to home delivered meals, from on-site programming to virtual programming. DSAS is proposing an increase of $680,000 to allow centers to expand their home delivered meal service and virtual programming. This concludes my presentation. And do you have any questions or comments?
Thank you very much, Director. Are there questions by my colleagues?
Mr. Chairman?
Yes, I think.
Will you, Gallagher?
Oh, thank you, ma'am. Ma'am, what's the total that you spend yearly on our seniors and programming?
In our 2020 budget, we were allocated $22 million.
Okay. This is a comment to my colleagues. We have over 100,000 more seniors in Cuyahoga County than Franklin County. They are outspending us close to 5 to 1, and I'm going to be kind with that number. It's embarrassing. It's been embarrassing. I almost fault myself for not being more forceful or more tactful in getting more funding to our seniors. These are the people who are the reason we are here today. It's interesting to me that what year, ma'am, what was the year that the seniors will become the majority in this county?
2030.
Okay, the people that follow us and some of my younger colleagues that are sitting on the council right now, the shot is across your bow. The seniors are here, they're getting larger. In my home community, it's exploded. We've gone from a young community to a senior community. We need to seriously sit down and figure out, like Franklin County did, who has 100,000 less seniors than we do, how we are going to program and fund help for these seniors. We all know people that aren't eating. We all know people that are sheltered in place and are getting sicker in their homes. We know this. This COVID is not an excuse, but it has really highlighted the fact that these people are forgotten. They eat filet mignon in Franklin because of their leadership. They're eating cat food in Cuyahoga County because of this leadership, and that's what I stand and I put myself as part of the problem. This is another opportunity, another round of financing that we can look at this and do the right thing. I know things are difficult, but I'm not going to sit here and throw out, we need to throw money at a problem. The money's there and we need money. And I, once again, and I'll tell all the directors and I'll inform the administration, I'm coming again with facts and figures on a buyout. I'm coming again that savings that are going to be real dollars. I'm coming again to question why you haven't cross-trained individuals since the last time we talked about this. And I'm coming again and not going to accept any of your failed excuses that we can't afford to lose people. I'm coming again for these seniors who are going to be the majority. We think about everybody else but these seniors. All I'm asking to do is to catch up with Franklin County, and that still puts us 100,000 in the hole. But that's what I think our goal should be. So I'm going to be here trying to push this. I'm going to be here trying to find that money, which I think I have. And I'm not going to go away until we start addressing this in a real manner. Thank you.
Okay, thank you for that strong presentation. And I believe Ms. Conwell was next.
Okay, thank you. I concur with Councilman Gallagher. Through the chair to Director Tracy Mason. I don't know if you're aware of this, so I just want to basically find out. So Metro Health Hospital today presented that nursing homes are turning more into more home care for their hospitalization. Has Metro shared that info with you in order for you to see how that impacts DSAS?
No, he has not shared that with me. I am not surprised. The Ohio Department of Aging has been moving towards home care services as opposed to nursing home care. That we've been moving in that direction for the last several years. And so that is why our mission and our purpose is really to meet seniors where they are and help them maintain their independence in their home, because we know it's much more cost effective.
Okay, so if, I'm just bringing that to your attention so you can maybe reach out to Akram to really start getting a handle on that, because that will just drive a more wedge into what Councilman Gallagher stated. I mean, your department's gonna, if that is happening, truly happening, that's gonna fall on you. And so we want to get our arms around it.
Thank you.
Thank you, Chairman.
Any other questions?
I have just one question.
Ms. Baker?
Thank you. You mentioned in your opening remarks that we are at 24%. I believe it. You didn't give an age, but 65 or older, 300,000, which equals 24%. So in 2030, which is 10 years from now, that will increase to majority, which I guess would be 51%. How, in past presentations, we've had a breakdown of how we figure that, where the people are, what their ages are, how we go from 24% to 51% in 10 years, and what type of housing are they in? Are they living? Are they in nursing homes? Are they in independent living? Are they in their own home? Will you be providing that for us so that we can see, especially with it being such a huge issue to overcome, so that we can chart what we can anticipate in the next 10 years?
Absolutely, we can work on that.
Okay, I would appreciate seeing that. It may help too with the funding of what we can provide and understanding what's needed.
So, to Ms. Baker, I got the impression that the senior population would rise so that it was larger than the youth population, but not more than half of the total population. I think it might have been better if the director had used the term plurality rather than majority.
I understand. Thank you.
Any other questions for the director?
Yes, Council.
Yeah.
I'll yield to whoever asked.
Thank you, Mr. Chairman. Director Mason, several months ago, you were performing a survey, I guess, of our seniors in our nursing homes in relation to COVID-19. Did you complete the survey? Did you come to any conclusions? And will it be reflected in the budget, in the coming budget?
Yes, so we work with closely about 60 senior centers throughout Cuyahoga County. We reached out to better understand what their reopening plans would consist of. As you all know, the Governor DeWine reopened senior centers as of September 21st. We had very few that decided to open in September versus October. The majority have decided they would not bring older adults on site to January. So early on, I referenced that many of our senior centers had to pivot their services. So it's not that we're not providing any kind of programming. We are now making home visits. We are doing well check calls. They are delivering home meals. They are delivering activity boxes. So they're continuing to provide services, just not on site at their facility. And so, you know, we're still gathering data. Right now, the governor has mandated that In order to reopen your senior center, you must test your staff as well as the participants. And so many of our senior centers are challenged with trying to find a healthcare provider to assist them with testing. So we're meeting with the Cleveland Clinic as well as with the Public Health Department to determine how we can support a reopening plan for senior centers to open their doors safely. So there's still work that needs to be done to support our senior centers.
Okay, thank you.
Ms. Conwell.
Yes, and I think you probably just answered that a little bit, Director, through the chair to Director Mason. I had sent in a request earlier to specifically go over the savings that you had into the COVID time and the centers not being open in, for example, transportation. But I think you kind of just stated a little bit. You didn't actually give us the dollar figures though.
Yeah, so we've been working very hard with our partners as well as our contracts department to modify the language around services. So now, again, as opposed to providing funding for a congregate meal, which is provided a meal at the setting, we have changed the reimbursement rate to provide a home delivered meal because we know it costs more money to deliver a meal versus in a congregate setting. Nevertheless, we anticipate all of our partners, many of our partners being able to sync reimbursement, drawing down the majority of the contract that we have with them. So right now, our number is projected that we may underspend by about, I would say about $200,000 at this point, only within our senior centers. Did that answer your question?
Yes, it did, but I'm sure you have a need for that 200,000 of that was saved on that end for another program, or correct?
Right. I mean, absolutely. The demand is continuing to increase. For our additional $2 million, we're asking to support our senior centers around virtual programming, allowing them to expand their home delivered meals. Part of the problem is, as you all know, we've been in crisis mode on a daily basis for the past 7 months. So we've been trying to figure out, we thought we've met the need because we thought we would be past this crisis in May. Here we are in November trying to pivot and revisit our plan throughout the year. And so some of this is a timing, is the only reason why we have not been able to, our centers will not be able to draw down their entire contract amount.
Thank you. That's very helpful.
Mr.
Hey,
Chairman.
thank you very much. And
Mr. Chairman.
yes, Council.
To help you out on the numbers with population, the way I look at it is the senior population in 2030 will be larger than the youth population. But another way to look at it, and the way that I look at it, is that those seniors are somebody's parents or someone's grandparents or even great grandparents. So the interests of the seniors that not only fall to the seniors, but they fall to the teens and those in their 20s who clearly, I would hope, are concerned about grandma and grandpa, those in their 20s, 30s, 40s, and on up that are worried about mom and dad, and some of those have grandparents also. So when you look at the domino effects of age and the increase in the senior population, you're looking at well over 70% of the people have skin in the game regarding the senior population and how they're taken care of. And I think that's the right way to look at it, because anything we do, I believe, would be appreciated by certainly well over 70% of the people that have a concern. And I'm excluding the youth because they're so young. Certainly they would be piled on top of that. But the voting populace is another way to look at it. And the seniors become very dominant. And the last time I looked, in 2030, they would be the dominant party, if I can say that, in voting in Cuyahoga County in 2030. So a couple different ways to look at it, but my point being is that everything's interconnected with the care of our seniors.
Okay. Thank you very much. And Director Mason, one further question. You mentioned 990,000 for options, 100,000 for emergency assistance fund, $680,000 for senior centers. What was the number that is programmed for the expansion of the information and services program?
230,000.
230?
Yes.
230. Okay, thank you. And any other questions by my colleagues? Okay. Thank you very much, Director. We appreciate the presentation and all the important work that we're doing, and we're all behind the additional 2 million and wish it could be more. Thank you very much.
Wonderful. Well, I'm going to move us along now to the Office of Early Childhood and Rebecca Dormand, who I believe is still on. Rebecca, are you there?
I am here. Thank you, David. Good afternoon. This is Rebecca Dormand from Invest in Children and the Office of Early Childhood. Thank you very much for this opportunity to speak about the $5 million allocated to our successful universal pre-kindergarten program. As a brief reminder, we were able to double the UPK program capacity from 2,000 to 4,000 children through a public-private funding partnership that funded this expansion for the past 4 program years. Many thanks go to Council and the executive for supporting that expansion and enhancement of UPK so that 2,000 additional children and families have benefited from UPK each of those program years. This new $5 million from the levy represents sustainability for that program expansion and will allow us to maintain the program at 4,000 children. This funding is used to create the gold standard of quality in preschool programs in our community through direct funding to programs, extensive technical assistance and training for staff, for family engagement and support, for support in the classrooms for children with special needs, and a variety of other program needs supporting families. The dollars also provide scholarships to eligible families, which makes our gold standard accessible and affordable for low and moderate income families who otherwise could not afford it. In terms of accountability, we monitor our program on all quality standards annually, and Case Western Reserve has conducted a very rigorous study of UPK, demonstrating that our UPK graduates perform better on the kindergarten readiness assessment upon entrance to kindergarten and on the 3rd grade reading assessment. And they're performing better than similar matched peers who attended high quality but not UPK programs in our community. I'm also proud to say that we just won another national award from Johns Hopkins University for our family engagement practices, and just read you what the award letter said. This is your organization's 6th National Network of Partnership Schools Partnership Award, clear evidence that UPK is a national leader in organizing and continually improving goal-linked plans and practices of family and community engagement. It is particularly noteworthy to earn a Partnership Organization Award this year when your organization and its schools were addressing the challenges of COVID-19. Invest in Children's mission is to achieve equity and access to services. And while any child in Cuyahoga County may attend a UPK program, when we select sites through our RFP process, we do give priority to sites that serve low income and minority families. Currently, approximately 70% of the children attending a UPK program are from minority families. Most of those children are African American. So that concludes my brief presentation. I'm happy to take your questions now.
Questions by my colleagues?
Councilman Miller, this is Chantel.
Ms. Brown.
Thank you. Dr. Dormand, the question that I've previously posed. So how how many seats have been, do we have any vacancies right now with the increase of slots?
So that's a tricky question and it's a good one. So just as a quick reminder, the state briefly shut down childcare except for pandemic childcare back April and May. We did have 5 programs that did stay open as pandemic sites. In the reopening, there was a group size of 9 plus for preschool for children with 1 adult in the classroom. Subsequent to that, the state then increased and allowed programs to go back to the license standard, which in our programs would be 20 children per classroom. Nearly all of our UPK programs have opted to stay at that smaller group size and are pretty much full. We have some programs who did go back to 20. So are we serving in classrooms or virtually fewer children now? Yes. But it's not vacancies as much as a smaller group size that programs have decided they needed to do in order to, first it was to comply with the governor's guidance and then to stay safe. Quite honestly, many staff are concerned, and out of concern for both staff as well as the children, this is what our programs have opted to do.
So there is significantly, sounds like significantly less numbers being served. And then by virtue of that fact, it seemed like there might be some natural attrition of facilities and venues. Is that a safe assumption, or how are our providers faring?
So far, I'm pleased to say I think our providers are doing okay. Definitely there are some programs that have closed and some others may close. The state has provided a subsidy for September, October, and November for programs who stayed small, so that's helped. We've increased our funding to programs and our scholarship amounts, recognizing that we did have the ability to do that, and that has also helped programs. These new $5 million, so our program year straddles 2 budget years, which always makes it sort of crazy making as we talk about this. So the $5 million that we're talking about would be for August 1st of next year when the new program year starts, and we hope and anticipate that programs will have gone back to their normal group size by then. That is, I think, what we're all hoping.
And in the absence of, let's say we hope for the best and plan for the worst, has there been any conversation or thought relative to reevaluating the model to try to make it a little more COVID compliant or friendly in the worst case scenario? Because I feel like not just our UPK students, but there's going to be an educational gap that results from this. And so what type of, if any, strategy or thoughts have been given relative to that?
Well, first, to respect our programs, our technical assistance is now all virtual. Programs are not even allowing parents to come inside. So all of this is being done virtually, and I'm pleased to say very successfully. I think in terms of addressing the fact that there are many children, though, who are not in preschool, we've looked actually at our Spark program, which is a home visiting model that is also being provided virtually now that really focus on school readiness for 3- and 4-year-olds. And we are actually working to develop a partnership with Say Yes to Education to help them, because they're working with CMSD families, many of whom have opted not to put their children into the virtual preschool, and to say, is there another way to provide services? So we're trying to look at all of, we have obviously a whole continuum of programs. We're trying to figure out, I think in this case, Spark might be the best answer to the question you're asking. But certainly we're open to continuing to evaluate the situation.
So Spark is an emphasis on the home program.
Sorry. Spark, yeah, Spark is our, it's a program provided to preschoolers. We typically target preschoolers or preschool age children, I should say, who are not in preschool, but its focus is very much on helping parents and direct their children for school readiness. So it's unlike some of our other home visiting programs focused on infant mortality. So as we've looked at the landscape of what we need to do to address the fact that many fewer children are in preschool, we're trying to figure out which of the programs that we have in our continuum might be best suited to do that. So Spark is already sort of focused on that. So we're looking at using that program. There are UPK programs who are doing virtual preschool services as well. We continue to try to figure this out.
Thank you very much. Thank you, Mr. Chair.
Sure. Thank you.
Other questions?
I have a question, Chair.
Ms. Baker?
Thank you. It's very good that we went from 2,000 to 4,000 children and that we had private sector funding to help us with that increase. Do you see private sector funding continuing? I know we have, of course, now the 5 million that sustains that 4,000 students, but are we still reaching out to those original supporters that thought that they were going to be giving ongoing? Do you see a continual contribution coming through outside of what the county is contributing?
I think, thank you very much for the question. I think perhaps for some of the targeted initiatives, for example, the Mount Sinai Foundation has been funding our special needs intensive model, which allows us to provide extra technical assistance around children with really deep end special needs. I would imagine for those kinds of targeted initiatives, yes. I think for sort of the basic operating support, I think the plan all along was we needed to find sustainability. But for example, I just submitted a request to the Cleveland Foundation for the Spark program, which I just mentioned. So I think we're going to our private sector partners to help us with other needs right now, believing that we had found the sustainability plan for basic operations, but could pull in private funds as needed for these sort of special focuses within the program.
Okay. So the private funding that was initiated to get this program started doesn't sound like it's a sustainable way of continuing the funding as perhaps we thought at the beginning it would be. I'm not quite sure what to think of that, but.
Well, I think I know that conversation happened a long time ago, but when we created that private fund, which the executive and Paul Clark, former regional president of PNC, co-chaired, we had a subcommittee looking at all options for sustainability. We looked at state, federal, et cetera. And in the end, sort of the committee arrived at the conclusion that the levy increase would be the most realistic and feasible approach to sustainability. And so that's where we landed. And we did, as I said, it was a public-private folks on that group. But the impression that I think those private funders had that they had done what they needed to do and that they expected us to find a path to sustainability.
Okay, thank you for that. If I may, the 4,000 students that we have now, what percentage of population does that service? Are there more children out there? Are there twice as many kids? How are we doing in trying to reach?
Yes, thank you for that question. So there are approximately 28,000 preschoolers out there. Not all families want to send their child to preschool. So we estimate maybe 70% uptake. So we're not maybe quite serving a third of them with UPK. Of course, there are children in other preschools, but not in our program.
Okay, that's
Yeah.
good to know. What did you say your preferred class size was again?
Our pre-pandemic and post-pandemic class size is 20 children.
So
Limit, yeah.
the 28 students that you thought to begin with is what you would service no longer is thought to have in a classroom? I mean, if we increase it 8 students more, perhaps we could get more of those children into the UPK program.
Well, the group size is seen as a real hallmark of quality in terms of being able to, we require 2 teachers with 20 children in order to give, both it's just for the environment in the classroom as well as how much the teacher can interact with a child, et cetera. So we feel strongly that 20 would be the limit on that. And as I said, in the governor's pandemic rules, it originally went down to 9 children and 1 teacher. And I will honestly, what we've heard is for many teachers and children, having that small classroom is one silver lining of the pandemic, that actually some of the children who had more behavior issues calmed down a bit. I mean, it's because we've been so concerned about how are the children managing with all the stress around them, and actually having that smaller size group has been beneficial for them. So that's one small silver lining that I can point to.
Okay, that's interesting. I guess I would be concerned about the other children who aren't in those small classrooms. You know, you have it down to 9.
Yeah.
Where are the other 11 children? How are they managing?
We are, I will, I'm sorry to interrupt, but you know, parents are, we don't right now have a lot of waiting lists because parents are concerned about putting their kids into care, quite honestly.
Just one last question. You mentioned about the 3rd grade reading guarantee.
Yes.
What percentage of our children are passing?
It was the exact statistic on that, and we can't find all of the kids. It's a real, it's a challenge, but so I've got that here. So they scored 0.3 standard deviations, or about 5% higher on the reading proficiency test. So it's looking at incremental improvement, but in terms of the on track, off track, which is, that's the assessment that's done in the kindergarten assessment, and that's being on track to pass. So our, this is the case study. So universal pre-K kids were significantly more likely to be on track for language and literacy. And then this is matched with kids, all the same demographic, neighborhood, risk, background, so it's fair, who got a similar amount of high quality, not UPK, but high quality. So 65.8% of UPK kids were passing versus 47% of kids in high quality preschool. Now, we assume that the difference would be obviously much bigger if we had compared them to low quality or no quality, but UPK is an enhancement model. So it's the most conservative test. So 20% more kids were on track. And of course, you know, things happen after, not an excuse, but no one asks people, you know, to hold kindergarten teachers responsible for if kids are, you know, passing. Preschool has attracted a lot of attention as having some, we're not, it's no inoculation and it's not magic, but we do think we give kids a much better start when they hit kindergarten.
Well, of course, sure. I'm sure from preschool to kindergarten is huge.
Yeah.
Huge. I just wanted to know if it was sustained.
Sure. No, thank you. No, we hope to keep following these kids. It's a challenge. This is what is in CASE's large data system called CHILD. So you have to go searching for kids in all these different school districts to find them, because, you know, the way that the data works now. But we have every intention of continuing to follow them up through school and high school graduation.
Great. Thank you. Thank you for your work.
Thank you. Thanks for questions.
Any other questions? Okay, well, I have additional questions, but time is moving on, so I'm going to do them offline and say thank you very much, Director, for the very important work that you do, and call upon Director Merriman to bring forth the next director.
Thank you.
Thank you.
So representing the Office of Homeless Services is Melissa Sirak, and many of you have met Melissa in committee meetings. I think it's well known that Ruth Gillette retired, and so this is Melissa's first budget presentation. But I know that she's given a lot of thought, and I've also instructed staff that I understand it looks like we'll be good till 4 or beyond. So, but we are tracking presentations. So I want to be good use of everyone's time. Melissa, are you still there? Are you muted? Oh, we can see you, we can't hear you. I think you still, we may have a connection problem. Try again here. Nope. How about we do this? We'll go out of order briefly while we'll see if Melissa can, Melissa, unless you can try it one last time, we're going to move on to Family and Children first and then come back to you. You might need to call in.
That sounds good. Let's move in that direction.
Wonderful. So I'm going to ask Robin Martin to present on behalf of the Family and Children First Council. I understand that she's here, she's county user, but unfortunately her video isn't going, just her audio, but she has been able to watch, just not present. Robin, are you there?
Can you all hear me?
Yes.
Okay, good. So I'm having the opposite issue. Good afternoon. On behalf of the Family and Children First Council, I would like to thank the County Council and the County Administration for your support of service coordination and youth development. The Family and Children First Council Office is the policy and planning entity for the county that works across all child-serving public systems on service coordination and youth development. In the last budget, we were awarded $750,000 in levy funding to support 3 areas. We want to expand out of school time. Our out of school time program has been operational since 2007, and this is the first time we are seeking to expand the number of sites that we are serving under out of school time. We would dedicate $225,000 of the funding toward that expansion, $50,000 toward coaching to onboard the new sites and to provide some specific coaching to the existing sites for to increase site quality. We did some training with the sites a year and a half ago around quality expansion, but now we want to do some specific coaching with them. And then finally, $50,000 for our transition services, which includes College Now, where we look at prepping our kids through the ACT and SAT boot camps, and the libraries who are offering tutoring sessions for our youth across the community. Our second area for actually, this is a new service, and this is under service coordination, and that is a service coordination dedicated crisis bed. And I know the Adams Board was on earlier speaking about crisis beds for the Adams Board. This bed would be different in that it is specifically for children who are involved in service coordination. We have had difficulty over the last couple years just based on community need and usage of accessing crisis beds for some of our service coordination kids. And so, for example, right now, I have 2, potentially a 3rd youth that is in need of a crisis bed, and we are unable to access beds because other youth are coming out of the hospitals needing those services. And then lastly, the FAST program, Families and Schools Together, is a parent program that services, it targets kids with families that have kids in the 3rd grade. And it focuses on families that have not actively been involved in their child's academic process. And it brings them in an 8-week cycle to do programming that includes the schools the community. And through that program, we seek to reconnect the families back to the academic process, but also to address some issues that may be happening in the home. So the programming is set up to target families that are at risk of substance abuse, abuse and neglect. And we work through this programming with these isolated families to get them reconnected back to the process. Right now, we are operating in 17 school buildings across Cuyahoga County. And like out of school time, this is another program that we have not expanded in several years. And this would be an opportunity to offer it to other school districts. We have had districts reach out to us asking for the program, but because we have been limited to this point to the 17 buildings, we have not been able to provide those services to them. And so I'm trying to keep my presentation brief because I know we've been on for a while. And with that, I'll open up for questions from council members.
Questions by my colleagues on FCFC?
Just really quickly, Councilman Miller, this is Chantel.
Yes, Ms. Brown.
Hi.
With regards to the after school program, how is that being executed with the virtual learning and children, not really going into the schools? Can you touch a little bit on that?
Absolutely. So right now we have 58 sites that are operating for out of school time. And of the 58 sites, 54 have either a hybrid program or a virtual program that they have been able to offer. We only had 4 sites that came back and said that they were unable to provide services. Now, the virtual program was easier in the summer because what they did is if they offered services 4 days a week, they did 3 days virtual and then 2 days hybrid, and the service would be outside. And we understand it during the winter months, the services may be all virtual, but young people are still accessing the programs. Even though it's online and they've been online during the day for school, it's still a release because they're doing more creative programming that the kids are actually more engaged in. It's kind of their downtime to still reconnect, sometimes to youth that go to their school, but oftentimes youth that go to other schools as well.
Okay, good. So it's also providing kind of like a socialization outreach type of component, it sounds
Absolutely.
like. Absence of that. Okay, that's interesting. Okay, thank you very much.
Councilman Miller, Conwell.
Ms. Conwell.
Through the chair to Director Martin, and this might be better answered by Administrator Merriman, I don't know, but you concerned me when you stated that it was very hard to access the crisis bed. And I thought that was taken care of some months ago in terms of making sure there was a crisis bed available for you. And I didn't know it was contingent upon the new HHS levy dollars coming in. Can you share light on that, or Mr. Merriman?
Yeah, Robin, let me just say first, for DCFS, we have a crisis bed that is under contract with us that is just for kids that are in custody that need to be placed on an emergency basis. That we could talk more about that under the DCFS presentation. That bed is in place and it's being very effectively used. Robin, if you, I think, have a different bed in mind, so why don't you talk about the program you referenced?
Yes. So under service coordination, we are required by the state of Ohio to service kids that are involved in multi-public systems. So the youth that come to us typically have an open case with the Department of Children and Family Services, but not always. The Juvenile Court, the Adams Board, and the Board of Developmental Disabilities. So they're being touched by multiple systems. Right now, what we're seeing is we have some families, especially during this COVID time, where the kids are having a very difficult time managing themselves, whether it be at home or in the community. And the families are coming in saying, I don't want to relinquish custody of my child, and can you help me? And so oftentimes these kids just need a quick assessment to figure out if they are appropriately connected to the right systems, Sometimes we're looking at the accuracy of their medication. And then sometimes we're looking at longer term stays. And if that is the case, we're then connecting them to those state funds for multi-system youth, where we are drawing down those dollars to pay for a longer residential stay for them. But the kids, they're having some significant issues. And when we look at the crisis beds that are currently offered by the Adams Board, when I say access, it's not that we have a hard time calling somebody to get the bed. Their beds are often filled. And we are really trying to prevent this parent from relinquishing custody, because that's actually going to be their next step, is to call DCFS and say, just take the child. And there's no abuse or neglect. It's just the parent can no longer manage the child because there's some extenuating circumstances oftentimes around with our teenagers, them taking their medication.
Okay. Okay, thank you.
You're welcome.
Chair, if I may have a question. Thank you. And this may not include you. I'm really not sure. I'm wondering if it, kind of gravitates over to you. With the schools that are now and didn't used to be hybrid, and for those schools that may be ending at 1 o'clock instead of 3 o'clock, because kids go in perhaps earlier, do you find that the need of parents for their kids and the services increase because there's time at home that was never there before? Does that gravitate over to you, or is that a different service that you would, if they came to you and said, I can't take care of my child between 1 and 3, I'm working, and my child care provider, whatever they used to do after school, or perhaps this program used to help after school, now has to begin earlier in the day and maybe more often during the week. Do you get calls like that?
We have not, but a lot of our families, that doesn't mean that those families don't exist and that they aren't receiving services that are connected to us. Many of the families are probably calling Starting Point directly and requesting to be linked to a program that has an earlier start time for them. So just because the call isn't coming to our main line doesn't mean that those families aren't connecting to the programs and aren't a part of our numbers.
Okay. Thank you for that. Just curious. I appreciate everything you do.
Thank you.
Okay. Anything else? Okay. Director Merriman.
Wonderful. I'm going to try to go back to Melissa Sirak. I think she's called in and she's on video at the same time. So Melissa, are you, I think I see you muted at the bottom there. Are you on with us? She may be in the lobby. Could I ask to see if anybody could check to see if Melissa's in the lobby? I think she's at a 440 number.
Hey, David, this is Janine. No, I don't see her in the waiting room. I did see a call-in number that was admitted.
Melissa, are you there? I can see your video. We still don't have you on audio. Oh, she's showing that she's on the phone. But...
Right, it's muted. I can't unmute it, so she will have to unmute it. The phone number.
Okay, let's try this one more time, and then if not, we're going to bounce and then come back to it. Oh, the joys of technology.
Can you hear me now?
We can.
Yes, we can hear you.
I'm sorry.
Just like the commercial.
This is a great introduction. All right. Good afternoon, everyone.
We welcome you and we congratulate you as the new Director of Homeless Services and look forward to working with you. And please proceed.
Thank you very much. I appreciate everyone taking the time with me today and for the opportunity to discuss our proposal with you. As noted, under the OHS subsidy, our office will be utilizing the 2.1 additional levy dollars to support permanent supportive housing. The Housing First initiative was established in 2004 with the intent of constructing 1,000 permanent supportive housing units to help meet the goal of ending chronic homelessness. This year, the last Housing First project will have been completed, and we will have met the goal of ending chronic homelessness. I think it's important to mention that each of these 13 Housing First Initiative solutions come with great economic impact in the means of capital, operating, supportive services, and public system involvement. Probably even more critical to mention is the human impact that comes with permanent supportive housing. By providing stable housing, individuals that are chronically homeless, which are the most vulnerable in our community, are able to focus on their mental health issues, their physical health conditions, and addiction issues while being provided with a space to provide health and recovery and healing. 95% of the individuals who move into PSH remain stably housed. The majority of those who leave PSH move on to independent housing or reunify with family, and less than 10% return to homelessness. The proposal we put before you is committing the $2.1 million of levy funds in 2021 to fill operating cost gaps in existing permanent supportive housing projects while adjusting the pool annually based on increase in units or need. Our office would like to conduct an RFP process to allocate these funds. The threshold eligibility criteria would include the following. The units must be dedicated to serving chronically homeless persons as defined by the U.S. Department of Housing and Urban Development. The tenant referrals are only through the Cuyahoga County Continuum of Care coordinated entry system, and there would be a per unit cap maximum of $1,500 that could be requested from these entities, and a $1 to $1 match would need to be documented. Gaps in permanent supportive housing funding remain as federal funding has remained flat and our operational costs continue to increase. To date, the county has not provided levy funding for capital, operating, or supportive services for the Housing First Initiative. So this support is greatly appreciated and will have tremendous impact. And I'd like to thank you for that and answer any questions that you'd have for me at this time.
Questions for the director? I have a question. And since you're saying that this money is going to be used to close operating gaps in the existing operating system, what would be the problems that would arise in the existing system if we did not provide this funding, and how long could we sustain existing operations without additional funding?
Councilman Miller, if we were not to provide this additional funding for the PSH units, the organizations operating these areas, whether it's for maintenance or actually operating and functioning the programs, would continue to struggle. To date, these gaps have increased. As I mentioned, funding remains flat, and the organizations are forced and have the pressure upon them to either continue to raise additional funding and look for other resources, or really just make do with what we have. So at this point, as we continue to reach a functional zero of being able to house those that are chronically homeless, this allows us to leverage these funds with the levy support to embark upon new initiatives and serving other populations of need in the community.
Are there other questions by my colleagues? Okay, thank you very much. We appreciate this important work. The homeless system is a very important part of what we do. Director Merriman.
Thank you.
Thank you.
We're going to move on to the Office of Reentry and Crystal Bryant. Crystal, I see you joining us.
Yes, thank you, Director Merriman. Good afternoon, members of Council and Committee of the Whole. As you all know, the office continues to shift its role in the spectrum in terms of priority functioning as a convener, capacity builder, advocate, initiatives coordinator, which means we fill gaps in the community, and a funder. As we continue to align with this role, we are here to introduce two particular new programs: entrepreneurship as a reentry strategy, and also an employment assistance fund. Returning individuals face substantial hurdles in securing work, including limited resumes, employer perceptions regarding those who have served time in prison, and legal restrictions that limit the hiring of individuals with certain classes of convictions. As a result, recidivism rates are higher as formerly incarcerated individuals are left with few options for employment. According to the Prison Policy Initiative from 2018, unemployment rates for formerly incarcerated persons were 5 times higher for those of our general public. As noted by PPI, discrimination is a clear factor against those with criminal records. Having a criminal record reduces callback rates at 50%. Given the disproportionate rate of incarceration among Blacks and Latinos, the inability to successfully reenter the community also disproportionately affects communities already suffering from low levels of wealth and income. Connecting formerly incarcerated individuals who are returning to the community to entrepreneurship can provide a second chance at opportunity. As a grant maker, particularly concerned with issues of diversity and racial equity, entrepreneurship as a reentry strategy works to provide equitable outcomes and wealth building and second chances. Entrepreneurship will meet the program priorities of economic development and human service to benefit those returning from incarceration. Life skills and case management by providing business plan development, coaching and counseling in the principles of capitalism, economic and financial literacy, and of course, access to capital for formerly incarcerated persons. Concurrently, participants will work with a personal coach to ensure access to necessary supportive services to prevent recidivism and help them reach their personal and programmatic goals. Thus, this project will address both the personal and professional needs of formerly incarcerated participants while bolstering them with entrepreneurship thinking, skill development, and connecting them to existing resources, and also showing them, also allowing them to be second chance employers themselves should their business get off the ground and actually thrive. The second opportunity in which we would split this allocation would actually go towards employment. We are in the process now of launching a second chance staffing agency. And so the EAP fund, or Employee Assistance Fund, is one dedicated to employees, especially those receiving lower wages who face significant barriers to maintaining employment, many of which carry significant financial burden. Business leaders are often unaware of these challenges or possess biases that exacerbate the barriers or perpetrate socioeconomic disparities. These barriers can be regulatory obligations like parole supervision fees or fees to pursue a CQE, transportation expenses like your car or tire repair, or fees related to reinstating a driver's license and or a one-ride emergency trip. It could also be childcare expenses like increased co-payments due to wage increases or other barriers for job retention, promotion, and advancement. So the Office of Reentry is proposing to add funds towards employment's already existing second chance staffing agency contract that would shift some of these burdens and allow people to maintain gainful employment. So I know that was a lot in one mouthful. Any questions for me?
Questions by my colleagues?
Councilman Miller, I just not a question, just you said entrepreneurship director, and what was the second one? I'm sorry.
An employment assistance program. And just for clarifying purposes, Councilwoman Conwell, the $500,000 allocation that is being proposed, we would split the fee. $300,000 would be for 2 years of entrepreneurship training, and the $200,000 would be for 2 years of the EAP assistance fund. The entrepreneurship opportunity would be competitively bidded within the community, and the EAP funds would go directly to an existing contract we would have to amend.
Thank you.
The EAP again, Director Bryant?
Sure, the EAP fund is Employment Assistance Fund. Okay. So the idea is that much like we have EAP when we're in a crisis moment, a crisis for those who are underemployed or in impoverished communities for returnees, their crisis looks a bit different. Therefore, they often lose their positions once they actually finally obtain one for some of the smallest things in which they don't know how to problem solve for. So if it's one day that their babysitter calls off, you'll hear them say sometimes, well, oh, well, I throw up my hands, I can't go to work, and they lose the position. It could be one time where a tire blows out and they don't have the resources to get there. So something that looks simple to us as employees in terms of, well, just get on an Uber or catch a bus is always not so simple for those who struggle and have crisis situations. Even the barrier of onboarding, and sometimes the job may require that you have certain fits, certain shoes, certain tools. So it can pay for all those things, which is why it would be included and added to the second chance staffing agency's budget.
And the one thing you touched on with the entrepreneurship program, you touched on personal coaches. So would that be using some existing funds, or how would that work?
So this would be a totally new program that would be allocated. We put together a list for those who the RFP would go out to, it would definitely be entities who are already in this business, the business of providing entrepreneurship training and coaching. So they would be well aware of how to do coaching models for cohorts. They would learn how to do pitch competitions, financial literacy, credit building, etc. It would just have added components that are very specific to this particular population. And it will also include grant money from us in order to have some level of startup where they may have barriers to being able to secure a loan for a business, or if they are already business owners and they have a criminal background, they often have time scaling. If they have this additional support in terms of grant money, it may make a financial institution more open to providing additional resources for them to grow their business.
So is the model for that model relative to the entrepreneurship portion? So are some of the funds going to be used as grants and some of the funds used to provide the training?
Yes, so for the entrepreneurship model, that's all rolled up in one. Those are all the things that they will have to provide with the $300,000 allocated over a 2-year time period.
Okay. All right, I think I understand. Okay, thank you very much.
Okay. I'm sorry, I know I was going through really quickly.
No, it's okay. We're par for the course with you, Director. Thank you.
Further questions for Director Bryant? So I would just add a comment that we all know of the greatly disproportionate impact of the criminal justice system on the minority community. So these are very important tools in the fight for greater equity and diversity and reducing disparities.
Thank you, Councilman Miller. We appreciate those words and support.
Okay, thank you very much for the presentation. Director Merriman.
Okay, so we're gonna finish with our final department presentation. Unfortunately, Director Cindy Weiskettle had a conflicting medical appointment. She may be joining us still out of that late, but she's asked her key deputy, Jackie McCrae, to provide the overview. As I led with, I talked initially about the drop-in center. So Jackie McCrae will be presenting on the emergency child care center, and then I think the kinship program. Will also happily answer any other questions. Jackie, are you there?
Yes, I'm here. Thank you, David. Good afternoon, and thank you for this opportunity to talk about our proposal and also for your support of the Division of Children and Family Services. The first opportunity I'd like to address is that around kinship programming. Approximately 1,000 children in DCFS custody are currently placed with kin. This represents a little over a third of the children in DCFS custody. We know from both research and experience that children are more likely to thrive in the care of someone connected to them. Research confirms that children in foster care placed with kin experience increased placement stability, as well as higher levels of permanency around guardianship, custody, and through adoption. Despite it being in the best interest of children in custody, it's not always financially feasible for kin to take on the added responsibility of caring for their relative. Unlike foster parents, for kin, it's not likely a decision that they've had a lot of time to think about. Kin who assume unexpected or an unanticipated responsibility for caring for additional children can quickly confront significant financial challenges, particularly those relatives who may be on a fixed income already. The kinship program will initially focus on DCFS children currently placed with family. Of the approximately 1,000 placements will be provided with additional financial support based on the age of the child. And we expect the program will grow as new kin placements are aggressively sought through dedicated staff who are engaged in intensive family finding and engagement intervention. The cost of the expanded placements will be tracked and assessed against projected foster care placements. We are looking that this would likely cost around $3.3 million for the kinship support. And this support would be based upon the age of the child. Our second opportunity for allocation is around emergency child care support.
DCFS is committed to ensuring that children in need of placement are placed in the appropriate setting as quickly as possible and are not allowed to wait for extended periods in the Jane Edna Hunter building awaiting that placement, particularly for periods extending 24 hours and beyond. We're diligently working to ensure that children are not spending prolonged periods of time in the Jane Edna Hunter building, and with providers who have provided additional opportunities and supports to us, we have been successful in terms of that. At this time, the county currently staffs the room with 4 full-time staff from 8:30 to 8 p.m. with additional staff that are on call in the evenings and weekends to care for children who are awaiting placement while in the building. DCFS recently closed an RFP. In fact, the RFP was closed last week to secure emergency child care resources for children in need of placement, while more permanent placement was being secured for them. The 1.5 million that we are requesting is proposed to be used to increase the, to support the additional costs that will be resulting from the RFP recommendations. So at this time, that concludes my presentation. Are there any questions?
Chairman, this is Councilwoman Brown.
Thank you very much, and we will go to Ms. Brown.
The 3.3 million number, is that a full year or a partial year?
That is for a full year.
Okay, thank you.
You're welcome.
And I would like to just add that the procurement is still technically open as it relates to the emergency childcare room. So although the RFP is closed, we're still reviewing proposals. So there may be some limits to what we can share and what we can discuss in today's meeting in the nature of the proposals.
So regarding the emergency childcare room, hopefully this is not wandering off into that area, but my question is whether the money is for capital expenditure in the way of constructing facilities, or is it for personnel and services, or how is it allocated between those two?
So I'll ask Jackie if she could speak on the nature of providers, but this is entirely through a partnership with an outside entity. It is not proposed for any capital changes within the Division of Health and Human Services or Department of Health and Human Services or Children and Family Services. Jackie, can you speak in general on whether or not the proposals are more focused on staffing or capital changes?
The proposals are more focused on staffing.
So basically you're saying that we're going to contract with an outside agency to provide both the facilities and the staff to run this program.
That's correct.
Okay, thank you.
You're welcome.
Other questions?
I have a lot, so I'll ask offline, Councilman, Chairman.
Okay, fine, thank you. Other questions? Okay, thank you very much, Director and Ms. McCray.
Thank you.
I believe that's all that that is all the presentations that we had today. I do have some just follow-up remarks. I do think as we presented the need to have some portion of the levy dollars used to address COVID in expenses, one of the components I talked about, but maybe not in enough details, we have recognized that there are many agencies in this community that have lost the ability to raise funds due to reduced social gatherings. And I think a lot of what we're hearing as it relates to the VOCA program is that there are existing trauma-focused services that are really at risk as a result of the loss of those unrestricted funds. So I think, as we move forward, I know that Catherine Tkachuk will be reaching out to council, that she has further items that she'll be proposing. And I understand there will be a lot of questions, and then we'll certainly be coordinating whatever services and programs we have with Catherine and council.
So, Director, the one area that was on my list that we haven't heard very much about this afternoon is say yes to education. And I'd like if you could provide us a little bit more detail on how it came to be that we require an additional 2.6 million and how much of that is just that part of it was not included in the budget by error and how much of it was related to that we had hoped to get some federal funding that we didn't get, and if you could explain what happened there a little bit.
Absolutely. I know Walter talked a bit about this. I know he's still on. I will provide an overview, also see if Walter wants to add anything. This is principally about that the money was not put in the budget for unknown reasons. I can't speak to that, but this is putting the money into the budget. It still assumes that we will be able to draw $40 for reimbursement. I will say that we had been advised that $40 were a clearly appropriate opportunity. There was an opportunity for us to seek reimbursement. We've continued to work with the state of Ohio, and I think I can say that we're still pushing them to ensure that past commitment on their part is able to be carried out. The commitment they made in the past was I think as policy has changed, they've second guessed it in some ways. So we've gone back to them with specifics and are asking for them to sign off on the exact uses that we've proposed. It seems like a clear condition for us that that 4E requires that the counties address the long-term abuse as well as foster care needs of families. The new Families First program, not to be confused with our Families First program, sees this as an allowable expense. Unfortunately, the state of Ohio is behind other states in implementing Families First. So there is still some policy review going on at the state level that could have further confused this. Walter, would you add anything further to my description?
No, Councilman Miller, the only thing that I guess that I would truly add is what was originally budgeted, but really not in the budget this year was 1.1 million. We're actually asking now for 2.6 because what David has found is that only 50% of the kids are Title IV eligible. So in essence, we're asking for $2.6 million now in the budget rather than just the 1.1. So the whole program costs 6.6 million on an annual basis. The true intent was that Title IV would cover 3.2 million, the levy would cover 1.1, and the CMSD would cover the remaining $2.3 million. What's happening here is the Title IV portion is only going to be half the number. It's going to be 1.6, requiring the county then to pay the other 1.6.
So the 4E money is about 50% of the total, but it's
about 50% of the total, but what's been found is that only 50% of the CMSD kids are Title IV eligible that are being served by the family support specialists.
Okay, so we were expecting the 4E to provide 3.2 million, which would have been about more. It would have been half total, but
half of the total cost.
But we're only expecting to get 1.6, which is when you add up the CMSD portion, the levy portion, and the Title 4E portion. The Title 4E portion is now only like 30% of it or so. Is that correct?
That's correct.
Okay. So, Director, one other thing I would like you to just confirm what we exchanged on questions over the last day, which is that in terms of where the expected costs go from here, there is one more year of build out to the full number of community support specialists that's intended, so that our cost for next year would grow from 2.6 million to 3.85 million. But that would represent the full ramp up, and that thereafter the cost would be about the same as opposed to increasing further. Is that correct?
That is correct. Next year would be year 4, and we would be fully staffed at 106 family support specialists.
Any further questions by my colleagues about Say Yes?
Yes, I'm sorry, I was on mute. Just to
Okay, Ms.
clarify,
Baker.
thank you, Chair. Just to clarify then, after the 4th year, what will be the contribution that we will have to make to sustain it?
The county contribution will be 3.85 million.
For every year after the 4th year?
Correct.
Okay, so where, Chair, did you see that it was going to be diminishing?
To Ms. Baker, no, I did not make any statement like that. The idea was that year 4, which is 2022, would be the final year of ramp up.
I see.
And that after that year, it would there would not be further annual increases, but neither would it go down. It would be pretty much constant thereafter.
Okay, so 3.8 million will be our contribution from the 4th year on. That's a pretty significant contribution.
Yes, it is.
Yeah. And Director Merriman, do you see that perhaps being supplemented by federal funds? Or do you think we're not going to get
I mean,
that?
that's, you know, the key issue here is that 40 is changing. And Ohio law and their policy around it is still in development. So, you know, in our discussions internally and with the state, we've made, I think, a clear case that this should be, there should be heavy 4E reimbursement, because, you know, these services are absolutely directly addressing and preventing child abuse and neglect, preventing cases from becoming custody. But, you know, I think at the time, the state is still, or at this time, the state is still drafting its policy of this, the Ohio policy related to a new federal law. So it is in flux to an extent, and we're going to continue to push to maximize the federal funds.
Okay, that's good to know. I'm sure you will. Thank you, Director.
Okay, so I'd like to thank everybody for their presentations and everybody for being patient. It's been a long afternoon, and so what's next on our agenda is that we come back on Thursday at 1 o'clock, and hopefully at that time we're going to consider any further amendments that might be required, and hopefully pass the budget update resolution out of committee to the full council at the following Tuesday's council meeting. I would mention to Director Parfiowitz that if there are any administration budget amendments, we typically get some late, mostly technical amendments at about this point in the process. And so if you have any of those, we'd like to see them ahead of Thursday's meeting, and we'd like to get them incorporated into the resolution at that time.
Okay, very good, Councilman Miller. I will do a check-in upstairs. Currently, I don't have anything to really add to the recommended update at this time.
Okay, so then this will conclude our second of our hearings on the 2021 budget update, and I would ask my colleagues if anybody has any miscellaneous business. Hearing none, And there being no further business that requires our attention, I thank everybody for their time, effort, diligence, and attention, and this meeting of the Committee of the Whole is adjourned. Thanks again.
Thank you.